Testing 1 2 3. Testing 1 2 3. One, two, three. Testing. Testing 1 2 3. Test.
ไม่ดีใกล้ไหนพี่ก้าอยู่ข้างตรงกลางข้างบนหน่อยค่ะไม่น่าจะโดนบังตรงนี้เห็นอยู่ยังใส่คอนแทคมันอยู่ตรงกำลังหาไม่ลอย
กำลังหาไม่ใส่กันอยู่ไม่รู้จะนิวหายไปไหน
นัดสลับกันไปได้ไหม
ไม่คือมันพังไปทั้งฝั่งมันพังทั้งฝั่งมันเหลือแค่อันนี้ตัวเดียวเดี๋ยวให้น้องแอลแล้วได้หนูขอเอาได้เลยพี่ชาชาขออนุญาตยืนอยู่ตรงนี้หน่อยมันจะได้แล้วลินเวลาพี่ชาชาจะต้องอ่านคำถามกับคำตอบนี่ไหมคะโอเคใช่ให้แอลเป็นคนเดินแล้วลินไม่สามารถเดินได้ถ้ามีอภิษนั้นแม้ว่าสถานการณ์จะนั้นมันเกิดขึ้นเราต้องรู้ให้ได้อันนี้คือประมาณสถานการณ์ตอนที่เราในนั้นอ่ะจริงใช่ไหมจริงละใช่ไหมโอ้ใช่เยอะเน้นอย่างเดียวเล่นมุกทำอะไรก็ได้ขอให้มันมีอะไรขึ้นเพราะว่าตอนนี้ตัวละตอนนี้ทุกคนช็อกว่าแล้วถ้ามันเป็นชั้นต่อมาเราต้องเปลี่ยนความคิดให้ได้เราเป็นพิธีกรเรามีไมค์ถ้าเรามีไมค์เรามีพลังพูดได้หมดเลยนะใช่ไม่เป็นไรก็ในระหว่างที่แบบดำเนินงานในมิชชั่นเราก็สามารถมีความสนุกขึ้นมาเรื่อยๆได้เหมือนกับเราอยู่เชียงใหม่
Test, test, test. Hello and welcome back to Silver Floor, everyone. So there has been some issues, but we're back now. And we still need some saving to do because Silver Floor, like the crystal hasn't been imprisoned yet. Like it's still there, so you guys need to save us. So participants from Division 3, please come down to this stage. We will begin shortly. You can look at the names here. Thank you so much. Okay, so are you guys like prepared? Hello, what team are you from?
We are from Indonesia, UGM.
So, like, did you prepare really well last night?
We prepare as hard as we could.
Wow, good job, guys. I'm rooting for you. And actually, everyone, too. Okay, so we're starting the first round right now, okay? So, let's see the keyword.
The keyword is lung. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 55-year-old man presents with dyspnea and a non-productive cough. Chest X-ray shows right upper lobe infiltration with a nodule and eggshell calcification of hilar lymph nodes. A biopsy of the nodule reveals the images pictured below. H&E stain, low and high magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds left.
Five seconds left. Time is up. Let's see the correct answer.
The correct answer for basic question is silica and carbon, while the correct answer for the advanced question is tuberculosis.
Let's see what the contestants answered. Whoa. So only one team decided to use the advanced crystal first. Their strategy is very unique in my opinion.
Maybe they try to like save the best for last.
Yes, and for the other teams, wow, there are a lot of answers going around, but I feel like only a number of teams will win. So let's see who got it right and wrong. So Team GOC got it right and PKC got it right too.
Does anyone want to make an appeal? 5, 4, 3, 2, 1.
Okay, so we're waiting for this. Oh, we don't have to wait now. It's ready. Let's see the scoreboard.
This is the scoreboard before grading. And this is after grading. In first place, we have GOC. In second place, we have PKC. And in third place, we have NU2.
Wow, this is really impressive. A lot of you guys really did clear crystals. So let's move on to round 2. Let's see the keyword.
The keyword is breast. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 63-year-old woman presents with a left breast mass in the upper outer quadrant for over 6 months. She has no other symptoms. Core needle biopsy and immunohistochemical study were performed and are shown below. H&E stain, medium magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds left.
Five seconds left. Time is up. Let's see the correct answer.
The correct answer for the basic question is invasive lobar carcinoma, while the advanced question answer is stomach.
Let's see what the contestants answered. Wow. What do you think, Lyra?
I think everyone's off to a great start.
True. Okay, and for the advanced ones, I think they answered correctly. You guys are so cool. And for the basic ones, well, it's a really long answer. You need to type down 3 words all at once. And it seems like someone actually got it right. So let's see who got it right and wrong. Wow. So does anybody want to make an appeal?
5, 4, 3, 2, 1.
Okay. Then let's wait for the scoreboard. And it's ready.
This is the scoreboard before grading. And this is after grading. In first place, we have Game of Clones. In second place, we have PKC. And in third place, we have UTAR1.
Wow, GOC and PKC, you guys are doing great. And everyone else too, actually. I'm really proud of you. And then we'll move on to the next round. Let's see the keyword.
The keyword is central nervous system. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 30-year-old woman is evaluated for headaches and gait instability. MRI shows a posterior fossa cyst with a mural nodule. Past medical history includes pheochromocytoma resection, and current screening reveals bilateral renal masses and multiple pancreatic cysts. Histology as shown, H&E stain low and medium magnification of the cerebellum mass demonstrates a highly vascular tumor with numerous small capillaries and intervening stromal cells. The stromal cells have clear, vacuolated cytoplasm due to lipid accumulation. Immunohistochemistry shows positivity for inhibin alpha and S100, but is negative for EMA.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left. Time is up. Let's see the correct answer.
The correct answer for basic question is hemangioblastoma, while the correct answer for the advanced question is von Hippel-Lindau disease or syndrome.
Let's see what the contestants answered. Wow, okay. I think this is a really hard question.
Yes, but someone got it correct for the advanced crystal.
Yes, again, this happens a lot, right? Like, the advanced ones got it right all the time.
Good job, everyone.
Yeah, and, like, you know what? I don't even know how to pronounce that word. Hemangio something? But let's see who got it right and wrong. Wow, so does anybody want to make an appeal? Okay, there has been an appeal.
Excuse me, thank you for the chance. Can our answer be validated? Because in the question, they ask for diagnosis and for the overall spectrum is associated with von Hippel-Lindau. I mean, there is not specified what diagnosis. Is it the diagnosis of the disease of the overall or is it the diagnosis of the tumor?
Please wait while we process your appeal.
Thank you.
Thank you for your appeal. UGM, right? Okay, it's our fault about our question that's not clear that we give the point to you.
Congratulations, UGM. Thank you for appealing.
In our aspect, we would like to ask about the tumor, but the question is not clear enough. Yes, it makes you confused, so sorry.
Thank
so we
you,
give you
Professor.
point.
Thank you. Okay, so we're gonna calculate a little bit more, you know. So while we're waiting for the calculations, let's just interview you. So, how do you feel after the appeal?
We are very grateful to the jury for giving us the chance, and actually we are grateful.
Thank you so much. So any team who wants to appeal after this can do so. Let's see who got it right and wrong again. Congratulations. Then we're going to wait for the scoreboard. And it's ready. Let's see it.
This is the scoreboard before grading. And this is after grading. In first place, we have PKC, who's cleared all of their advanced crystals. In second place, we have GOC. And in third place, we have UGM.
Wow. Okay, then let's just move on to the next round. This is getting really exciting. There's a lot of changes. And let's see the keyword.
The keyword is head and neck. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 50-year-old man has had a 3-centimeter painless, slow-growing mass in the right preauricular region for 5 years. He undergoes excision, and the histopathology of the mass is shown in the picture. H&E stain, low magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left. And time is up. Let's see the correct answer.
The correct answer for the basic question is pleomorphic adenoma, while the correct answer for the advanced question is salivary duct carcinoma.
Let's see what the contestants answered. Wow, there's a lot of different words jumbled here, Lyra.
Yeah, and everyone chose the basic crystal for this round. I wonder why.
Yes, and like I don't even know these words. It seems like you guys have different opinions, so if the time comes, you guys can also appeal again. As we can see that there has been a successful appeal last time. Okay, we're checking the answers. Are you guys nervous? But maybe you guys will get another chance. Okay, let's see who got it right and wrong. Okay, so only 2 teams got it right.
Does anyone want to make an appeal? You can also make an appeal against a correct answer.
5, 4, 3, 2, 1. Okay, then we'll wait for the scoreboard. And it's ready.
This is the scoreboard before grading. And this is after grading. In first place, we have PKC with only 1 crystal left. In second place, we have NU1. And in third place, we have the GOC.
Guys, you can do this. You can do this. We're nearly there. You guys, most of you guys nearly clear it. So let's move on to the next round. Let's see the keyword.
The keyword is female genital tract. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 50-year-old perimenopausal woman presents with abdominal uterine bleeding. Endometrial biopsy reveals a malignant gland-forming tumor composed of back-to-back glands without a solid area, as shown below. H&E stain, medium magnification.
Your 60 seconds starts now. You have 30 seconds left.
You have 5 seconds left. Time is up. Let's see the correct answer.
And the correct answer for the basic question is endometrioid carcinoma grade 1, while the correct answer for the advanced question is P10.
Let's see what the contestants answered. Wow. So the grade thing is really an issue, right? Because like even though you know what that is, like endometrioid carcinoma, you need to choose the grade. That is really hard. So let's see who got it right and wrong.
Does anyone want to make an appeal?
Yeah, it seems only 2 teams got it right. Okay, 5, 4, 3, 2, 1. Let's wait for the scoreboard, and it's ready.
This is the scoreboard before grading. And this is after grading. In first place, we have PKC. In second place, we have NU1. And in third place, we have GOC.
Guys, you are so impressive. Thank you for trying so hard to save Lyra for me. Let's move on to the 6th round. Let's see the keyword.
The keyword is white blood cells, lymph node, and spleen. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 68-year-old man presents with bone pain, anemia, and recurrent infections. Bone marrow biopsy shows diffuse infiltration of cells shown in the picture. H&E stain, medium magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left, everyone. Time is up. Let's see the correct answer.
And the correct answers for the basic question is plasma cell myeloma, while the correct answer for the advanced question is CD138 or CD38.
Let's see what the participants answered. Whoa, guys, this is so cool. So for the advanced ones, only 2 teams choose to do it. And for the basic questions, there are a lot of teams that answered similar ones too, and also someone who answered differently. So let's see who got it right and wrong. Well, a lot of team got it right, Lyra.
Yeah, good job, everyone.
Yeah,
does anyone want to make an appeal?
Twinsies. Okay, so 5, 4, 3, 2, 1. Let's look at this scoreboard.
This is the scoreboard before grading. And this is after grading.
Wow. I'm so proud of you, PKC and NU1. You guys completed all of the crystals, but we still have 1 round left, right?
Yes, we do.
Yeah, we have the final question here. So, let's do it. Let's see the keyword.
The keyword is endocrine system. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
The gross and microscopic findings of a rapidly growing right thyroid mass resected from a 30-year-old man has shown in the pictures. H&E stain medium magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds left.
Five seconds left. Time is up. Let's see the correct answer.
The correct answer for the basic question is papillary thyroid carcinoma, while the correct answer for the advanced question is BRAF V600E mutation.
Let's see what the contestants answered. Wow, okay. So actually I think someone got it right. This is the final round, as you guys know, so be prepared to make an appeal if you want to do so. And let's see who got it right and wrong. Oh, so apparently everyone except for the advanced crystal got it right.
Does anyone want to make an appeal?
5, 4, 3, 2, 1. We're waiting for the scoreboard, and it's ready.
This is the scoreboard before grading. And this is after grading.
Wow, great job, everyone. So we're waiting for the final scoreboard. Please give them a round of applause. Each crystal represents different way of calculating their points. So we'll need some more time to look at the remaining crystals. Are you guys nervous? Who will go to the resurrection round? Okay, and the final scoreboard is ready. Congratulations! PKC and NU1 will move on to the semi-final, and GOC and UGM, you guys will need to fight in the resurrection round. Thank you so much. This is the end of Division 2. Oh, sorry, Division 3. So you guys can go back to your seats now.
Good job, everyone.
You guys are so cool. Every team here. And also the audience too.
How they know อันนี้น่าจะใช้ต่อได้เลยค่ะ
ไม่ใช่อย่าลืมตัวสับนะสารชันสรุปก็คือต้องใช้ไม้สลับกับน้องใช่ไหม
เพราะว่าไม้หนึ่งอันเขาเอาไปข้างบนแล้วมันไม่กลับออกมา
ไม่
เพราะว่าตอนแรกอันกรรมการไม่มีไม้เอาไปบน
เอ้าแล้วมีการใช้กรรมการกันที่หงอกมีข้อนี้เพียวอ่ะอุ้ยชาอ้ายน้องจะทำแบบนี้กับพี่น้องจะไม่มีเงินมาซื้อโอเคเหรอเพื่อเขาเข้ามาไม่ทันไปชิงช่องข้อสามปะข้อสามก็กลับมา
คิวก็ได้ไม่ก็เลยเป็นแบบว่าเขาก็เลยรับสลับกันแต่
เราไม่ต้อง
For anyone who wants to take a break for a while, you can go out to the toilet.
check, 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 check.
chơi này chơi
Hello, everyone. Test, test. Okay. Hello, everyone. So, after the Division 2 has been completed, we will have a tie break round between Met, Para, and Team TU. So, you guys will have to stay here for a tie break, okay? Test, test. Yo, yo. Test, 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 test. Hello, everyone. An announcement. So the participant is now fully recovered and he is okay now. Thank you, everyone, for your cooperation. Yeah, we will now fully continue the next division. So participants from Division 2 can come down now to the stage.
Elliot, can you read the name of the teams again, please?
Okay, so we have Inflammates, BM Detectives, Sirirat 2, Cool Cool Crew, Seppu Slayers. Thank you. Lyra, can you help me read out the other 3 teams here so that they know?
We have Sierra 3 and Washira Emia and
Jula 1. Okay, are you guys ready? If you're ready, can I hear some reaction from the contestants, please? Woo! And what about the audience? Can I hear some noise, please? Yeah, can you do it louder, please? One more time, the loudest, okay? The loudest as you can do.
Can you say it louder, please? Thank you, everyone.
Thank you. Okay, so we're starting the first round right now. Let's see the keyword.
the keyword is disease of infancy and childhood. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 3-day male infant was delivered while cesarean section at 28 weeks of gestation. On the first day of life, he developed tachypnea with difficulty breathing. Physical examination found a fast heart rate and blue skin discoloration. Unfortunately, despite aggressive treatment, he passed away. An autopsy was performed and reviewed the histological findings of the lungs as the picture below. H&E stain, low magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left. And time is up. Let's see the correct answer.
And the correct answer of basic equation is hyaline membrane disease, neonatal respiratory distress syndrome.
Wow, so all of you guys decided to choose the basic ones. So we're waiting to check the answers. There are two names for this disease. I wonder why. And I feel like most of the answers are pretty similar too. Maybe you guys will all get the same points. Maybe you all clear your crystals. We can never be sure. Lyra, are you afraid in that cold cave?
Yeah, it's quite cold over here.
Yes, over here too, actually. Okay, so let's see who got it right and wrong. Congratulations, everyone. You got it all correctly. So no one wants to make an appeal, right? Then let's move on. We're waiting, and the scoreboard is up.
This is the scoreboard before grading. And this is after grading. In first place, we have CCC. In second place, we have SI2. And in third place, we have BMD.
Yeah, this is so fun. Like, everyone started the first round equally. So let's start the next round. Let's wait for the keyword. And it's ready. Let's see it.
The keyword is gastrointestinal system. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 55-year-old man presented with long-standing heartburn. Endoscopy showed extension of the tongue of rat, velvety mucosa 3 centimeters proximal to the gastroesophageal junction. A biopsy was performed, and the microscopic feature is shown. H&E stain, low magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
You have 5 seconds left. Time is up. Let's see the correct answer.
And the correct answer of basic question is Barrett esophagus. And the correct answer of advanced question is CDKN2A or TP53.
Let's see what the contestants answered. Wow, the advanced question is really advanced, as you can see. And the basic one is actually really cool because I think everyone got it right. So let's see who got it right and wrong. Oh. Does anybody want to make an appeal? You can raise your hand now.
5, 4, 3, 2, 1.
Okay, then we're moving on. Okay, we're moving to the scoreboard and it's ready.
This is the scoreboard before grading. And this is the scoreboard after grading. In first place, we have SI2. In second place, we have MDCU1. And in third place, we have VJR.
Okay, I'm so pumped up right now. I really want to know what will happen next, so let's move on to the next round. Let's see the keyword.
The keyword is heart. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 35-year-old woman presents with palpitations and occasional syncope. She also complains of constitutional symptoms, including fever, malaise, and weight loss. A transthoracic echocardiogram reveals a mobile mass in the left atrium attached to the intra-atrial septum. The mass is resected and shown in the picture.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left. Time is up. Let's see the correct answer.
The correct answer of basic question is left atrial myxoma, and the answer of advanced question is interleukin-6 production.
Let's see what the contestants answered. Wow. Okay, so the basic ones actually have similar answers. Maybe like the cardiac and the atrial ones. I don't know how they will grade this. And for the advanced question, this seems like a really advanced question. So we'll see who got it right and wrong. Does anybody wants to make an appeal?
5, 4, 3, 2, 1.
Okay, no one. So let's move to the scoreboard.
This is the scoreboard before grading. And this is the scoreboard after grading. In first place, we have SI2. In second place, we have BMD. And in third place, we have Inflammates.
Wow, SI2 and BMD, you guys are on a roll. So let's move on to the next round. Let's see the keyword.
The keyword is I. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 68-year-old man present with abnormal vision. Ocular examination shows uveal abnormality as shown. His pathology of the lesion is shown in the picture. H&E stain low magnification.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
5 seconds left. Time is up. Let's see the correct answer.
And the answer for the basic question is uveal malignant melanoma or malignant melanoma. And the answer for advanced question is GNAQ or GNA11.
Let's see what the contestants answered. Wow, so only one team decided to use the advanced crystal, Lyra.
And I think a few got it correct for the basic crystal.
Yeah, do you know these words?
No, not at all. Fairies don't learn this.
Yeah, we don't do med school. So let's see who got it right and wrong. Does anybody want to make an appeal?
5, 4, 3, 2, 1.
Then let's move on. Let's see the scoreboard.
This is the scoreboard before grading. And this is the scoreboard after grading. In first place, we have SI2. In second place, we have BMD. And in third place, we have Inflammates.
Well, so SI2 and BMD, you guys are doing great. And actually, everyone here too. Inflammates is catching up. And also CCC and SS. Let's move on to the next round. We're waiting for the keyword, and it's ready. Let's see it.
The keyword is skin. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 60-year-old man present with multiple tense fluid-filled blisters on the tongue and arms. Physical examination and histopathology of the blisters are shown in the picture. H&E stain low magnification. The blisters do not rupture easily.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left, everyone. And time is up. Let's see the correct answer.
And the correct answer for basic question is hemidesmosome. And the answer of advanced question is eosinophil.
Let's see what the contestants answered. Ooh, this is really impressive. I mean, the answers seem simple, but the questions, they're not that easy. We're waiting for your answers to be checked. So right now you can try to calm down a bit, okay? And let's see who got it right and wrong. Does anybody want to make an appeal? You can raise your hand now.
5, 4, 3, 2, 1.
Then let's see the scoreboard.
This is the scoreboard before grading. And this is the scoreboard after grading.
Wow, this is intense because SI2 only have one advanced crystal to clear, and the other teams also, like CCC and SS, they have basic ones to clear too. So let's move on to the 6th round. Let's see the keyword.
The keyword is blood vessels. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 25-year-old woman presents with severe chest pain and syncope. Autopsy examination of the aorta, shown in the picture, reveals a transverse intimal tear arrow in the ascending aorta with blood dissecting through the media.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
5 seconds left. Time is up. Let's see the correct answer.
And the correct answer for basic question is aortic dissection or Stanford type A or aortic dissection, DeBakey type 1 or type 2. And the correct answer for advanced question is Marfan syndrome, Loeys-Dietz syndrome, Ehlers-Danlos syndrome, or Turner syndrome.
Let's see what the contestants answered. Wow, as there are a lot of choices to choose from, I think this question is pretty easy, right, Lyra?
Yeah, I think there's a lot of correct answers too.
Yes, that's right. So you can literally pick and choose which one you want to answer. And if you know how to spell it correctly too, I think that's quite the hardest part for me. Lyra, are you afraid in there?
Not anymore. I think I can leave this cave soon.
Yes, there are so many brave heroes here to save you, and they're doing a terrific job. We're waiting for your answers to be checked. Lyra, are you rooting for any team right now?
Just rooting for every team in particular.
Yes, that's the correct answer. I'm cheering for every one of you because you really did your best today. And also, like, the whole duration of preparing for this moment today. As there are a lot of answers to choose, we might take a few minutes to really check all of them. And let's see who got it right and wrong. Wow, congratulations. Does anybody want to make an appeal? Okay, there has been an appeal.
First, we think that the question want us to answer the clinical feature of the disease that represent this question. So we think Marfan syndrome represent the Pexat escobatum. We answer the Pexat escobatum for refer to Marfan syndrome.
The question asks about identify one clinical syndrome, not clinical presentation. Pectus excavatum is a physical examination, right? So it's a clinical manifestation, not clinical syndrome, as the question showed. Sorry.
Thank you.
Thank you for making that appeal. So, let's move to the scoreboard. Oh, sorry. Let's see who got it right and wrong again. Okay, it's still the same, right? So, let's see the scoreboard.
This is the scoreboard before grading. And this is the scoreboard after grading. In first place, we have SI2. In second place, we have inflammates. And in third place, we have NDCU1. And they all have only one crystal left.
Wow, okay, I'm so excited because this is the last and final question, guys. Let's do it. Heroes, you should try your best here, okay? Because this is your final chance of saving my sister and also move into the semifinal of the resurrection round. I wonder what the keyword will be. Oh, and it's actually ready. Let's see it.
The keyword is pancreas. Contestants, you have 15 seconds to choose your difficulty level. Time is up. Let's see the question.
A 30-year-old woman presented with abdominal discomfort. Abdominal computed tomography reveals a 6 centimeter solitary encapsulated cystic mass in the pancreatic tail. The mass was surgically resected, and the histopathology is shown in the picture. H&E stain low magnification. Immunohistochemical staining of the neoplastic cells showed the following results. Cytokeratin faintly positive, chromogranin negative, synaptophysin focally positive, CD56 focally positive, and beta-catenin diffuse nuclear and cytoplasmic reactivity.
Your 60 seconds starts now. Contestants, you have 30 seconds remaining.
Five seconds left, everyone. Time is up. Let's see the correct answer.
And the correct answer for the basic question is pseudocytopapillary neoplasm or pseudocytopapillary tumor. And the correct answer for advanced question is CTNNB1 mutation.
Let's see what the contestants answered. Wow, so I feel like the answer is really hard to type down, right? The spelling too. And a lot of people answered differently. So I wonder what the results will be.
And everyone
Lyra.
shows a basic crystal too.
Yes, that's right. Because I think most of them cleared most of the advanced ones, right? So, let's see who got it right and wrong. Oh, unfortunately, no one.
Does anyone want to make an appeal?
5, 4, 3, 2, 1. Let's see the scoreboard.
And this is the scoreboard before grading. And this is the scoreboard after grading. So we have SI2 in first place, Inflammates in second place, and MDCU1 in third place.
Yeah, since no one got the last question right, the scoreboard remains the same. Now we're gonna wait for the final scoreboard. Oh, I'm so excited. I really want to know how you guys managed to get through all of those 7 advanced and really hard questions. Lyra, are you proud of them?
Yeah, I'm really proud of them for coming this far.
Yes, and if everyone actually saved my sister, I would really appreciate you. So right now, I think there might be a tie break, so we're waiting for some calculations. Lyra, can you tell me your feeling now?
I'm feeling quite nervous for the tiebreak round because it's about accuracy and precision.
Yes, and I mean you're nearly there. You're nearly getting to the point where you're going to be saved. I'm so happy for you and for the contestants too. What about you, audience? Are you excited for the results? I can't hear you. Thank you so much. Even though I have these big ears, I still have bad hearing. Okay, some more calculations to be done. Lyra, how about you interview some contestants there?
Or should we interview members of the audience?
Up to you, Lyra. Okay, so do you guys want to be interviewed, audience? I think no, right? Okay, so how about you guys interview the contestants while we're waiting?
Maybe just random one of them.
Yeah, just random.
Randomly
Which team are you from?
Right? Can you say that again?
What's your name?
My name is Lyra.
My name is Much.
How is your team doing?
Had a great.
Okay, good answer. Thank you.
Okay, you know what? I feel like we need some more interviewing to do. How about you interview Inflammates, Lyra? Up there.
Oh, I think it's not the time to interview. There's someone tell me something, whisper for me.
Mm-hmm. Oh, okay. The tie break is ready, guys. And sorry, we're looking into it. And it will be a tie break between BMD and WeJR. Okay, this tiebreak is to determine the 4th place, who will move on to the resurrection round. So only BMD and VJR will be doing this tiebreak question. We're waiting for the keyword, okay? So, guys, be prepared. And for everyone else, you guys can also try to answer it because it will be good for your upcoming examination in your medical student life. Am I right? Yeah, thank you. Okay, so we're letting you guys calm down first before we start the tie break because it's going to be quite intense. Since it's a tie break, there will be no advanced or basic crystal to choose from. You guys only have one question and then you need to answer it, and then we will also look into like the time that you try to answer it. If you do it so quickly, maybe you'll get on to the resurrection round.
Just a reminder that you're graded based on accuracy and time.
Yes, so this is really, really exciting for me. Lyra, so if you have to choose between living in that cave or coming out to see me and be with me again, what will you choose?
Maybe I'd rather live in this cave.
Why?
I think I like it here. I like being an only child.
Me too. I want to be an only child too. Okay, so everyone, the tiebreak is officially ready. We will begin shortly. Okay, and the keyword is ready.
And the keyword for the tiebreak round is lung. You have 60 seconds.
According to the pathologic description, what is the diagnosis? Okay, let's see the question next. You have 15 seconds. I hope you read all the question.
Okay, so maybe the timer is having some technical difficulties right now since we're on silver floor. So okay, so now you have 15 seconds remaining. Oh, sorry, some misunderstanding. You have 60 seconds. Okay, so we're letting you guys read the question over and over again because this is really, really important. It's the tiebreak round after all. Sorry for the misunderstanding, okay? So you will have 60 seconds to answer this question. IT, please start the timer. Heroes, you have 5 seconds left. Time is up. Let's see the correct answer.
And the correct answer is primarily hematoma.
Let's see what the contestants answered. Whoa, okay, so they have different answers and it seems like they're not the same answer as shown up in the board. But we're checking it. Let's see who got it right and wrong. Unfortunately, no one answered correctly. So, does anybody want to make an appeal? BMD and VJR, you can raise your hand. Okay, 5, 4, 3, 2, 1. Let's start another tie break. The keyword is ready.
The keyword is gastrointestinal system.
Let's see the question.
According to the pathology description, what is the diagnosis? A large pedunculate colonic polyp with elaborated contour. Histologic examination demonstrates a characteristic aborizing network of connective tissue, smooth muscle, laminopropia, and gland lined by normal appearing intestinal epithelium.
Your 60 seconds starts now. There are some technical difficulties, staff, IT. They cannot press on it. Okay, so there are some technical errors. We'll try to fix this as quickly as we can. As you know, silver floor is corrupted, right, Lyra? That's why we're having these difficulties.
It's quite corrupted.
Yeah, this is not anyone's fault. It's just the magic is gone. That's why. That's why everyone needs to come and save us.
I think it's the curse of the queen. She's
Yes.
maybe somewhere here.
Yes, there is an evil queen hiding among us. Be careful. Look around you. Maybe your friend is trying to trick you into thinking they're your friend. Maybe they're actually the evil queen.
She cursed us. She afraid that Layla will escape her curse.
Yes. So while we're working on it, everyone else can try to figure out and answer it.
All the team, if you see the question, just try to answer, but not out loud. Just
Yes,
in your
not
mind.
out loud. You cannot do that, or else you'll be giving the other team hints. I mean, that would be really kind, right?
Yes, it's too kind.
Yeah, too kind. Not like my sister. I don't think she's that kind.
Why you say that to your sister?
Yeah, this is just peak sibling behavior, right? We always pick on each other.
Definitely 100%.
Yes. But, I mean, you guys still have to save my sister. If you're ready, we will tell you, okay? So, okay. Now, the technicalities is gone, so your 60 seconds will start now. Thirty seconds left. 5 seconds left, everyone. And time is up. Let's see the correct answer.
And the correct answer is posterior polyp.
Let's see what the participants answered. I think the spelling is really hard here. I wonder if they'll get it right. What do you think, Lyra? Okay. Yes.
I think the most important for this question is spelling actually.
Right? And there's like, the hyphen. I don't even know like if that's like important or not. Like what if we miss one thing? What if we miss one letter? Will that matter?
Not only the spelling, if both of them spelling correct, it depends on how fast they are.
That's right. I think like your time management is being tested here. Like even though you think you got the right one, you need to try to beat time. I think that's like the hardest part, right?
Yes.
What do you think, Lyra?
Oh, there's something happened to Ryla. That's alright, it's okay, Elif. You can talk with me.
Okay, so I think Lyra is being silenced in the cave.
Yes, maybe something happened to her, I don't know.
Yeah, so we're waiting for your answers to be corrected, so let's wait for a while. Okay, hi Lyra, are you back?
I'm back now. There's signal in the cave now.
Okay, the Wi-Fi isn't that good here. What about you, audience? Can you use our Wi-Fi? Or do you need to use your own, 4G or 5Gs?
Oh, the answer is now.
Oh, okay, the answers are right. Let's see who got it right and wrong. Wow, so, yeah, I think the spelling is really hard. And, polyp, adenocarcinoma, there's a difference.
I think it's a very close call.
Yeah, right, Lyra?
Both of them answer Pauchasia, but it depends on the judges.
Yeah, let's see who got it right and wrong. Oh, no one, unfortunately. It's okay. It's okay. We still, okay. Let's do another round of it. We're waiting for the next question, and it's ready. Let's see the keyword.
The keyword is kidney. Let's see the question.
Okay, the questions are coming in. As you know, the Wi-Fi isn't that great. It's running now.
A reminder that you're graded based on accuracy and speed.
That's right, Lyra. So be mindful of your strategy. Okay, so we'll let you stare into the word kidney for a while, maybe to contemplate what question will it be?
I heard the onion sound, ooh, something like that.
Yeah, I think kidney is a really hard topic, right? I remembered everyone in CMU complaining about learning kidneys because it's so complex.
Yes.
Yes, and especially if we're talking about the pathology of kidneys. I think that's a whole different level of hardness.
Maybe the question is not sent through the Wi-Fi. Maybe we just need the postman to send the question.
That's right.
Is there the postman in Silver Floor?
Yes, in Silver Floor we do have fairies who do many things like postmen. We also have police officers too, but they all have wings. And I think that's cooler than the human world.
And how about you?
Oh, I do nothing. Yeah, my whole life is just being here, talking.
And your sister as well?
Yes, my sister do nothing too, right, Lyra?
I think I do more, but you do the talking instead.
Yes, yeah, I am a certified yapper.
Just like me, I just being wise every day.
Are you sure about the wise thing?
Yes, I'm the most wise angel in the silver floor.
Okay, if you say so. So we're still waiting for the question to come.
I actually still need a postman.
Yes, that's right. What about you guys? Are you also working really hard in the human world? Can you answer me, please? I cannot hear you. Louder, please. Thank you. I love your hardworking spirit.
It seems like the question is ready.
Yay! Okay, so let's see the question.
According to pathologic description, what is the diagnosis? A kidney biopsy with glomeruli showing uniform, diffuse thickening of the glomerular capillary wall by electron microscopy. The thickening is seen to be caused by subepithelial irregular, erectile-dense deposits containing immune complexes. Basement membrane matter is laid down between these deposits, appearing as irregular spikes protruding from the glomerular basement membrane.
Your 60 seconds starts now.
Oh, it seems like the judges is here. He wants to see by his own eyes.
We have a winner!
And Team BMD, right, Elliot?
Oh yes, that's right. Congratulations. You win the tie-break round after 3 excruciating rounds of tie-breaks. Congratulations to all of you. You really did a great job. So, we'll have the final scoreboard up in a minute. Lyra, are you excited? Do you want to know who the winners are?
Yeah, I think we're about to know now.
Yeah, but I mean, it's quite obvious, and the final scoreboard is ready. Let's see it, everyone. Oh, okay, so apparently there will be no final scoreboard, but BMD will move on to the resurrection round. So congratulations, everyone. So this is the end of Division 2. You guys really did a great job, and you can go back to your seats and take a break. We are so proud of you. Lyra, do you want to thank them for saving you?
From the depths of my heart, thank you, heroes, for saving me. This reunion with my beloved sister could not have happened without your courage and kindness. Congratulations, teams, Teams Inflammates and MDCU1, for standing with us until the very end.
Yes, and thank you, audience, for really paying attention to the competition and answering my questions. I really appreciate that. But it's not the end of... Yeah, but don't forget we still have another tie break from Division 1.
All competitors, we still have the one tie break. For which team? Elliot, can you remember?
Yes, we have a tiebreak between MedTU and MedPara. So these two teams can come down.
If you want to go to bathroom, it's okay. But if you want to go to have lunch, just wait for a while. Just 5 minutes, trust me.
Yeah, and please come back to watch another tiebreak.
So, Lyra, do you still in the cage or you are free right now.
I guess I'm free from the cage now.
Oh wow, congratulations, you're free.
So, heroes, after another tiebreak between Matthew and Para team, we will announce who will go to the semifinals and who will go to the resurrection round again. So, please stay here to listen. Yeah, for like instructions and thank you so much. Okay, so anyone standing, you can come back to your seat and sit down. So because we still have some more competitions to do.
Please stay with us in silver floor. We are not finished yet. Just stay here.
Yes, one last tie break, which I think will be really exciting because as you know, like we're also calculating the accuracy and the time that you're using. And then we're also going to announce who will go to the semifinals and resurrection round again to make sure that you understand. So, what do you think of the last round?
It's actually one thing that thinking of in my mind is I have to read the question again.
Yeah, there are a lot of questions with really advanced words.
Yes, the judges, you had to pay me a ton of golden coins.
That's right. What about you, Lyra? What do you think about the last round that has just happened?
I think there are a lot of technical difficulties, but I think it's because fairies don't know how to use the internet.
Yes, we're fairies, so sorry on our behalf.
Only 2 teams, right? For
That's
tie
right.
break.
Yeah.
Okay.
And these 2 teams will have to try to answer as correctly as they can and as fast as they can.
Okay, Elif, how do you feel when you get your sister back?
Well, mixed feelings actually. I mean, I try to tell everyone that I want my sister to be saved, but maybe not right now.
You love to be just only shy, right?
Yes, that's right. Because, you know, we're sisters and I'm older than her, so I have to take care of her all the time.
I know you'll miss me when I'm gone.
I'm not sure about that, Lyra.
Lyra, do you miss your older sister?
Not a bit at all.
Me too. And also, about the other rounds, there will be a lot of playful characters and evil ones too that you'll meet throughout your journey in Silverfloor. So look forward to meeting them, okay?
One of the characters is in this room right now too.
That's right, they're hiding, I guess, but we can never know.
There's only 1 species in Silverfloor? Oh, I mean 2 species, angel and elf, right?
That's right.
There's no other species?
Yeah, so we're magical beings and some of them have fairy wings and some have like angel wings.
Like this?
Yes, we really had fun in the dressing room. Okay, and also I want to tell you more about Silverfloor. As you know, this is not just one city. It's a world. It's a world full of many continents and cities all around. So as you can see right now, we have different shades of crystals, and they look so spectacular. But after this, you may need to go to the world of the dead for the resurrection round.
And you might also meet some ocean sirens along the way.
That's right. We have sirens too, and they are gonna be in the semifinals round. So look forward to enjoying the view here. It will change anytime you start a new competition.
Let's see that name, Inflammate.
Yeah, that is so cool, Inflammate.
I don't know it is the same like friend pollutions. Just kidding, guys.
Yes. Okay, how about we interview the audience? Lyra, can you go and ask some questions?
Lyra, just choose one that you like.
Excuse me, which university are you from?
I'm from CICM.
Are you enjoying today?
Yes, of course.
Thank you very much.
I think this time is my round to
Yes.
interview someone.
Please do.
I think his face is so similar. I really used to him. Hello. Hello. Where are you from?
I'm from Thailand,
Thailand. And which city?
Chiang Mai.
Why you're here? You're competitors or GM?
I'm a group moderator.
You're a good moderator.
So you randomly choose to interview our GM.
Yes.
Wow. How about we try to interview the competitors?
Competitors?
Yeah.
Does anyone want to say something? You can raise your hand. I think no one.
I think they don't want to talk to us right now.
Okay. Oh, it seems like there's so many people not here.
Yes, maybe they need some toilet break.
Yes.
Yeah, I will be needing one soon too.
I'm so excited about the tie-break creation. I think it's maybe harder than the division 1, 2, or 3, right?
I agree because like tie breaks, you cannot choose the difficulty level. So I feel like all of them are considered advanced in my opinion.
And you're also graded based on speed.
That's right. And it's like really stressful when you're just competing between the two teams.
Yes, you not only have to answer the correct answer, but you have to do it faster than the other team.
Yes, and it's like, okay, if another team got it correctly, it's the end for your team.
Yes.
Like there is no other way you can redeem yourself.
Absolutely.
Yes. Thank God I'm not competing in CMU-IMC.
Yes. Oh,
And we have an update about the tiebreaker round. We'll be using a whiteboard, and you can only start writing on the whiteboard once the MC says that you have 60 seconds.
the judges will see on his own eye, right? Okay.
But as of right now, the teams for the tiebreak round isn't here, so we'll move it to after lunch.
That's right.
Okay, everybody, you can go to have a lunch. Oh, no, not right now. Oh, just waiting for a while. I'm so sorry. Even the warning from the angel, you shouldn't trust me everything.
That's right. I mean, I, for one, am not trusting you.
But you know, I'm the most wise angel in this world.
According to you, well, no one tells me about this.
What about the angel from the other division?
Oh, Sophia, another Sophia. I don't know if she's here or not. Another Sophia, are you here? Maybe she just fly to somewhere else.
Yes, and for the people remaining here, I want to ask you. So, are you excited for tomorrow? Because you're gonna be on tour tomorrow, right?
No, you just excited for today more than that?
Oh, really? I feel like the competitions aren't that exciting. I mean, traveling must be more fun.
And are you excited for today?
Yes. I think you're all excited.
Oh, okay. If after the tie break, what is the next round?
After the tiebreak, well, we'll have the resurrection round.
Oh, what is resurrection round? Do you know that?
Yes, of course we do. So, you know, as they're all dead according to the fairyland, so they need to try to compete for another chance of survival.
Oh, I have a good news. Is
we actually will start the tie break in shortly, okay? Because the teams are ready. So, Matthew and Para, if you're ready, you can come down to the stage. A round of applause, please, for the competitors.
welcome back to the stage.
Yeah.
It's team. It's team what?
Matthew and Para.
Oh, okay.
Okay, so
welcome back.
you guys will be using whiteboards, and you would not be allowed to write it until the timer starts.
You can only begin writing once we say that your 60 seconds starts now.
Correct, Lyra. You guys can do this. I believe in all of you. Okay, so again, to remind you, we will use whiteboards to answer. And we're also not allowed to write on the whiteboard until we say so, and we will say these words. Your 60 seconds starts now, and then after that, you will be able to write on the whiteboard. Okay, everyone, it's time. It's time for our final tie break. Let's do it. Let's see the keyword.
And the keyword for the tiebreak round is skin.
Let's see the question.
According to pathologic description, what is the diagnosis? Skin with well demarcated pink to salmon colored plaque covered by loosely adherent silver white scale. Histologically, the stratum granulosum is thin and extensive overlying parakeratotic scale with regular acanthosis is seen. Neutrophil forming small aggregate within the superficial epidermis and the paracarotic stratum corneum are noted.
Your 60 seconds starts now. You can begin writing on the whiteboard.
Okay, let's check the answer.
Which team? Which team? TU.
Yes,
Right.
to you first.
Correct.
So, congratulations, Matt, to you. You guys really did a great job. And also Para, too, because you guys tried really hard, and I appreciate that. So, Matt, to you, we'll move on to the resurrection round. We'll see you again.
Congratulations.
Thank you, everyone. Great job. So this is the end. This is like the truly the end of the quarterfinal round. Thank you, everyone. And we will tell you about the semifinal and the resurrection teams that will need to go after this. Okay, the resurrection round will start at 12:40. So be prepared, guys, if you need to come to the stage. Thank you, everyone. You can go and have your lunch now. Don't forget that the resurrection round starts at 12:40. You can come back here again. How about we say goodbye to everyone? Okay? 3, 2, 1. Goodbye. Thank you so much.
「 Testing.
Final scoreboard รอบนี้ไม่มี final scoreboard รอบสุดท้ายก็คือไป last question scoreboard
นี่กลับมาตรงนี้นิ่งน้องทำได้น้องเก่งมากสู้ๆเนี่ยก็คือสกอร์บอร์ดครั้งสุดท้ายคือทำได้ก็ได้ยิ้ม get in character get in zone you got this right not too low not too low not too low good ยังไงก็บอกได้พี่ดังนิดนึงทำได้เลยนะเก่งมากครูพร้อมไหมเดี๋ยวพี่บอกละ Station at your station.
Thorn.
Nix.
At your service. What fortune drives the desperate to accursed corners? Who dares try to dance in the shadows of the dead?
Restless souls, reaching for one last dance in the sun. How pitiful. You've lingered in the darkness for too long. Tell me, does your hope save you or curse you still?
So, you've come seeking fortune. Fallen souls, dreaming to rise again? Tell me, how steep a wager are you willing to risk for one more chance? Everything. What do you have to lose when you're already dead? I see.
Ah, so it is Silverfloor you are fighting for? Well then, heroes, here are our conditions.
This stage consists of 6 rounds. Each team will begin the round with 3 starting points. At the beginning of each round, a randomized keyword will be displayed. After reviewing the topic, teams must choose whether to place a bet using any amount of their current points, skip betting for that round. Once a decision is made, all teams will receive 1 short answer question related to the topic. If a team answers the question correctly, they will earn 1 base point plus twice the amount they bet. If a team decides to skip betting, they will earn only 1 base point. If a team answers incorrectly, they will lose the amount they bet for that round. For a team that decides to skip betting, they will receive nothing. It's important to note that after the 6th round, 3 souls will be subtracted from each team's total soul before determining rankings. The 2 teams with the highest remaining souls will move on to the semifinal. In the event of a tie, a sudden death round will be held, following the same rules as previously described.
And behold, these are the twins of temptation. One crystal holds Nyx's essence, the other my own. Not mere tokens, but our very hearts, sealed for your game.
One crystal holds power to cheat the abyss, to pull 3 souls back from the nethers. However, every game demands a price, and your souls will be the first wager placed.
Do you see, mortals? The deadliest wager awaits. 1 crystal for your return, and a fairy spirit undone. Will you trade our end for your beginning? Contestants, you may now enter the stage.
We invite all teams in the resurrection round to please enter the stage. Now, all our contestants are on stage. Place your bets, heroes. Speak your terms, for the final game rests beneath the shadow of our wings. Let the games begin.
And so the games begin. May the goddess of luck be on your side. And now, let's see the keyword.
The keyword is skin. Contestants, you have 30 seconds to place your bet. Your time starts now.
And as a reminder, contestants, the rules of the game are simple. You bet a certain amount of points, for example, 3 points. If you get the correct answer, you'll get double the amount, 6 points.
However, if you answer incorrectly, you lose all that you bet. So, bet wisely, and may the odds be in your favor.
And now, let's show the question.
A 30-year-old man with an itchy vesicular rash undergoes a skin biopsy. This patient has had a history of gluten consumption. The biopsy and the skin lesion are pictured below. Which immunoglobulin plays the most important role in the pathogenesis of this disease? Abbreviation can be used.
Your 60 seconds begin now.
Your time is up. Now let's see the correct answer.
The correct answer is immunoglobulin A or IgA.
And now, let's see what our contestants have answered.
There seems to be a variety in the answers, Thorn.
Yes, indeed, it looks like IgA is the most answered out of all of them.
Well, even if they didn't answer IgA, they could still be correct.
Interesting. Well, we'll have to see what the correct answers really are. How about this, Nix? How about we ask one of the teams why they answered IgA? Hello. How confident are you in your answer? Which team are you?
SI2.
Thorn,
I see.
it seems the answers are in. How about we see who actually got it right or wrong?
Yes, we shall.
Well?
And as expected, IgA is the correct answer.
If you believe your answer is correct, you can still appeal.
After all, IgE may be the correct answer. And it seems like the scoreboard is ready. Let's see the scoreboard. And wow, Team P53, who bet 2 points, got a profit of 3, making their team number 1.
Well, it is only the first round, Thorn. Things can easily turn for the better or worse.
So let's move on to the next question. Let's see the next keyword.
And the keyword is liver and gallbladder. You have 30 seconds to place your bet, and your time begins now.
So, Nix, what should the strategy be?
I say they played safe.
Played
How about you,
safe.
Thorn?
If it were me, I would always go all in.
That is a very reckless strategy indeed.
It is either everything or nothing, Nix.
Well,
No
if they
in
get
between.
it wrong, they will surely lose all that they bet.
We'll have to see about that. And time is up. Now, let's show the question.
A 40-year-old woman presents with a liver mass in the right lobe. She has no underlying disease. The resected mass is pictured below. What is the diagnosis?
You have 60 seconds, and your time begins now. Seems your time is up. Let's see the correct answer.
And the correct answer is focal nodular hyperplasia.
And now let's see what our contestants really have answered. I see some familiar names, don't you think, Nix?
That is true, Thorn. I wonder who is correct.
It would appear that the answers are ready. Let's see who really got it right or wrong.
Impressive. P53 has gotten it correct.
And as a reminder, you may appeal. After all, the other answers may be synonyms for the correct answer. And now let's move on to the scoreboard.
P53 in the lead once again, closely followed by GOC.
It would appear that they bet and played it safe. How about we move on to the next round? Nix?
Let us do so, Thorn.
Now let us see the keyword.
And the keyword for round 3 is gastrointestinal tract. You have 30 seconds to place your bet. Your time begins now. I wonder what the question will be for this round, Thorn.
Yes, I do wonder indeed. After all, the gastrointestinal tract is a very complex system.
I guess it's part of the fun not knowing what the answers is, or the question.
I do agree with that. And it would appear that time is up. Now let's show the question.
A 58-year-old man presented with abdominal pain and progressive abdominal distension. Imaging confirmed the presence of pseudomyxoma peritonei. Histological examination of the entire resected appendix revealed a mucinous epithelial neoplasm arising from the appendiceal lumen, showing both villous and focally flat proliferation. The lesional cells demonstrated severe nuclear atypia and formed crowded complex glandular structures, while the atypical cells exhibited pushing margins with extracellular mucin, noted dissecting through the appendiceal wall. No evidence of infiltrative or destructive invasion was identified. According to the current World Health Organization classification, what is the specific diagnosis given to this appendiceal tumor? Abbreviation can be used.
Your 60 seconds begin now.
Your time is now up. Let's see the correct answer.
And the correct answer is high-grade appendiceal mucinous neoplasm, or HAMN.
Now let's see what our contestants have answered. Impressive. I see HAMN.
And there is also other answers that may or may not be correct.
After all, this is a very, very complex question.
Fitting for our round, right, Thorn?
Of course.
How about we see who actually got it right and wrong?
As expected, Team P53 had gotten HAMN right.
A gentle reminder that not answering will also not get you any points.
But don't be too discouraged, everyone. You can still come back. After all, the later rounds is when things can go really wrong. And it would appear that the scoreboard is now ready. Let's see the scoreboard.
P53 once again. Impressive indeed.
Closely following behind by GOC. And now let's move on to the next round. And let's show the keyword.
The keyword is white blood cells, lymph nodes, and spleen. You have 30 seconds to place your bet. Your time begins now.
We are now halfway through.
Yes, we are, Thorn. But even one round could determine the fates of our players.
Yes, I would agree. Now the later rounds is where things get exciting. It is where people bet the most amount of points. And it is also where people lose the most amount of points.
A risky game indeed, Thorn.
Now, let's move on to the question.
This picture, H&E low magnification, is from a lymph node biopsy showing large atypical binucleate cells with prominent eosinophilic nucleoli scattered within a background of eosinophils, plasma cells, lymphocytes, and histiocytes. Which signaling pathway is constitutively activated in these tumor cells to promote survival and cytokine production? Abbreviation can be used.
You have 60 seconds to answer this question, and your time begins now. Your time is up. Let's see the correct answer. I wonder what the correct answer will be.
And the correct answer is NF kappa B.
And now let's see what our contestants have really answered. Familiar names, don't you think, Nix?
Yes, I see some teams have answered exactly what the correct answer is.
However, they seem to be different in terms of their spelling.
I mean, there is always nuance to answers. So, if you believe yours is correct, you can appeal. But after, we reveal who got it right and wrong. Even if you get it wrong, do not fret. You still have 2 more rounds to turn the tables into your favor. Now let's see who actually got it right and wrong.
And congratulations to Team UTM.
We seem to have an appeal.
We'd like to appeal for our answer. NFKB for the NF is nuclear factor. It's just the abbreviation of it. So I think it's also correct. Is it?
What do the supreme beings have to say?
Let us wait for their answer. See, Thorn, there isn't always only one answer to a
Thank
question.
you for your appearing. I'm so sorry to say that B stand for B cell, not beta. NF kappa B stand for nuclear factor kappa light chain enhancer of activated B cells. So B, not beta, it stands for B cell.
If it's English B, it's not beta. We should use the Latin word for beta. There is no word beta in here in the keyboard, so we think we should write it.
No. I mean, B in NF kappa B is stand for B cell, not beta. You type beta is wrong. You have to type NF kappa B cell is correct.
Okay.
Right?
All right.
Well, I'm sorry to say that the supreme beings have not decided that P53's answer is correct.
That is okay, though. You still have 2 more rounds.
Now let's see the correct answers again. And
Let's move on to the scoreboard. It seems even though they may have gotten a little bit wrong, P53 is still in the lead.
Interesting.
Maybe this is a sign that other teams may have to bet more.
And now Team GOC with nothing to bet. Oh, it would appear that there has been a glitch in the system.
Well, that gives us time to maybe talk to some of the contestants about how they feel. How about we ask Team MedTU how they feel right now?
The question is really hard.
She says our questions are very hard, Thorn.
I would agree on that.
But that is where all the fun is at, right?
Yes.
Winning
Well-
your soul back is not an easy feat. You'll have to earn it and use your luck. How about the other teams, Thorn? What do they feel?
How about I go up? Hello, where are you from?
From Chiang Mai University.
Chiang Mai University. A very familiar name. So, how confident are you in betting in the next round?
We're not gonna bet.
You are not gonna bet. Interesting.
An interesting strategy. Well, hopefully it will work out for them. How about we ask the other teams what their strategy will be?
Yes, Nix.
How about we ask the team from this side, Thorn? about we ask Team BMD? What will be your strategy for this round?
I think I will stay safe.
Staying safe. I
Play
like the sound of
safe.
that.
No, I do not like the sound of that.
Does that mean you will be betting, or will you not bet this round?
I prefer not betting, but let's see what's going to happen.
A wise team indeed, Thorn.
I would suggest going all in again. After all, you cannot win if you play safe.
Considering your history, Thorn, I thought you would have learned your lesson that going all in is a reckless strategy.
No. Playing it safe is the reckless strategy, as I have played it safe with my kingdom.
Isn't that a bit contradictory?
I went in half and half, and I lost it all.
See, if you would have just played it safe, you wouldn't have lost it all.
If I would have gone all in, I would have gained everything, Nix. That's why you were so poor in your background.
I think playing it safe is always the best strategy. How about we ask the team how they think and what they think about the strategies that we are arguing about, Thorn?
We shall do that.
Team Sirilatso 2. Excuse me.
What is your strategy for the next round?
All in for my 0 score.
All in.
All in from your zero scores. 0 scores is not all hope is lost.
Not
Nix.
all hope is lost, that is true.
Because if you get a correct answer, you will still get 1 point to bet.
We have designed these games so that everyone has a chance. But you'll also have to be wise about your strategy.
You can always turn the games around. How about I ask you, Nix? Why don't we place a bet of our own?
A bet of our own? Sounds intriguing.
I think of a team that I want to win, and you think of one.
I'm afraid I'm against playing favorites, Thorn. Goes against my morale.
If I win, I get all your riches. If you win, you can have mine.
What more could a king want? You already have all your riches. I grew up not as fortunate as you, yet you still want to take from me, Thorn?
Now, as we wait for the glitch in the matrix, how about we ask one more team?
Sounds like a great idea, Thorn.
Hello, team UGM. Where are you from?
We are from Indonesia.
Indonesia, the land down south. How confident are you in the next round?
We are doing our best.
Oh, and it would appear that the scoreboard is now updated. Team P53 has lost 3 points.
But they are still in the lead.
Yes. But do not worry, because things can always turn around.
That is true, that is true.
And now let's move on to the next question. And let us see the keyword.
The keyword is kidney. You have 30 seconds to place your bet. Your time begins now. The tensions are high now, Thorn. It is round 5, and they have one more round left after this.
Yes. How about they go all in again? If they win this, they win almost everything.
I mean, as we approach the end of this round, they will have to risk more than just a couple points to be able to make miracles come true.
And it would appear that time is now up. Let's show the question.
A 37-year-old woman presents with worsening leg swelling, fatigue, and joint pain. A kidney biopsy is shown below. Trichome stain, medium magnification. An immunofluorescence demonstrates full house staining with IgG, IgA, IgM, C1q, and C3. Given the biopsy findings and clinical presentation, which type of hypersensitivity reaction is most likely involved in the pathogenesis of her renal disease?
You have 60 seconds and your time starts now.
Time is up. Let's see the correct answer.
And the correct answer is immune complex mediated hypersensitivity or type 3 hypersensitivity.
And now let's see what our contestants answered. Wow, I see a lot of type 3.
Impressive indeed. It seems that this round will have more points to give than we thought, Thorn.
And now let's see who really got it right or wrong. And congratulations to all teams. Unfortunately, P53 is now red.
But you can still appeal if you wish to do so.
After all, type 2 may be the correct answer.
Maybe this is a good sign for the other teams. Maybe they still have a chance to win their soul back.
Of course, things can easily turn. Just like my past. I had it all, and now I've lost everything.
An unfortunate past indeed, Thorn. How about we move on to the scoreboard?
How about let's show the scoreboard again?
I wonder. But it seems P53 is still in the lead once again, Thorn.
It is a very close call between Team GOC and Team P53. And now, the final round shall decide who the winner really is.
The tensions are high for the final round, right, Thorn?
Yes, but other teams do not be swayed. The tides can easily turn. After all, P53 may bet all in and lose everything. However, that is a very risky strategy.
For the other teams, this could be the moment. Do not lose hope.
And now let's move on to the next question.
I wonder what the final round question will be.
And it seems like there has been another glitch in the matrix.
I guess victory won't come easy for this group of teams.
The divine beings have not been liking this so much.
The final round, tensions are definitely high. I mean, maybe this is the right time to go all in.
Yes, you can win everything in the final round.
The final push to earn your souls back so you can continue fighting for Silver Floor.
And now if you don't go all in, then how could you reign up on top?
But it will be such a shame indeed if they go all in and lose it all, Thorn.
We'll have to see about that. How about we ask the leading team?
I would like to know as well what our current leading team will do in the next round.
Hello, where are you guys from?
Indonesia.
Indonesia again. So, how confident are you in the next round?
Very confident.
You are very confident.
Confidence is indeed going to help them.
Yes. And now let's move on to the next keyword.
The final round. And the keyword for the final round is diseases of childhood and infancy. You have 30 seconds to place your bet, and your time begins now. It is
Yes.
finally the last round, Thorn.
Yes, the final round. To the teams that are not on top, do not worry, do not give up.
We only have 2 crystals to give away, so only 2 teams will move on to the next round.
You only have one chance.
What will it take for them to be successful in this round, Thorn?
It takes not giving up. It takes going all in even though the odds are in your favor. And now let's move on to the question. Interesting.
Maybe we should see the keyword once again. Let's see the keyword. Ah, it seems the keyword has changed.
The keyword is endocrine system. You have 30 seconds and your time starts now.
A little trickery in the last round, Thorn.
It seems that the supreme beings have set a different keyword.
I mean, I'm loving this, Thorn. So exciting
I am loving
indeed.
this too.
Will the little
tensions are
mishap
high.
affect our team, our players, in any way?
I do not know about that. We will have to see in the next scoreboard. And now, time is up. Let's show the question.
An adrenal mass resected from a 20-year-old man with a clinical history of hypertension is pictured below. If this tumor is put in solution A, its cut surfaces will turn dark brown. What is the solution A?
You have 60 seconds to answer this question, and your time begins now. Your time is up. Let's see the correct answer.
And the correct answer is potassium dichromate solution.
And now let's see what our contestants have answered for the final round.
The final round is not easy indeed.
I do not see potassium dichromate anywhere on the screen.
But maybe there'll be an answer that the divine ones will allow. We wish all contestants the best of luck because this is the final round.
Who shall rise and who shall fall? This round determines it all.
Who will get their souls back and who will stay with us for all eternity? I mean, staying here isn't all that bad, right, Thorn?
Yes, Nix, you cannot die here. And you can all have all the food you want. I, after all, have another name, Thorn, the devourer of all foods.
Thank you for that information, Thorn.
Okay, Nix.
If I was the contestants, I would be feeling really nervous right now.
Yes. The tides can turn at any moment. I, for one, am not well versed in this subject. I do not know whether anything is right or wrong.
I mean, this is the final round, but there could be a tie. And what if there's a tie, Thorn? What happens then?
There will be a tiebreaker. The tiebreaker has the same set of rules as the normal game.
Our contestants will just simply play another round.
Until one has more points than the other.
Now let's see who actually got it right or wrong for round 5.
Round 6. Nix.
My apologies.
And would you look at that sea of red? No one has gotten the correct answers.
As I said, your souls won't be earned back that easily. Let's see the scoreboard. Congratulations to Team P53 and GOC for winning their souls back.
A very close call indeed. If they would have gone all in, they would have lost all the points. Maybe going safe is the right strategy after all, Nix.
Well, I guess we'll never know what the right strategy is, because both strategies that we have been arguing about has either worked for them and
Okay.
haven't.
So now congratulations to Team P53 and Team GOC. Two remain where many fell.
Rare and delightful, you've danced with the abyss and returned with your souls intact.
Take your prize, heroes. Let it drown in the whispers of the dark.
And remember, it was we who gave you the light to outshine Death's shadow.
Now go. Mock the grave while you still can.
For your time will come again soon. Until we meet again, heroes. And remember, the dead are always hungry and always here.
So, Nix, the final round is finally over. How about we ask one of the teams how they feel?
That is a great idea, Thorn. Should we ask the successful teams how they feel in finally getting their souls back.
Sorry? Team GOC from Chiang Mai University, how do you feel about winning?
Relieved.
Relieved. Yes, you
Thorn?
came back from the dead.
I have received news from the Divine Ones. There seems to be a tie.
There seems to be a tie.
Yes. I guess the scoreboard was incorrect. And we
Interesting.
will have to play a tiebreaker.
The tiebreaker. The tiebreaker for the team that placed second and third place.
Definitely an unexpected turn of events.
Right, next.
I wonder which team tied.
That I do wonder.
Who still has a chance to play in the next round? As we wait for an announcement, what shall we do, Thorn?
Yes, what shall we do? How about we talk about my past?
There you go again. Always talking about yourself,
Oh, I
Thorn.
love rambling about my past. I am King Thorn, the king of the kingdom of Salvestia. I had ruled the world far away from the humans. We were pure silver floors. And so the curse has reached us very late. However, when the curse came, I did not believe it. I went down and slain all of the kingdoms within my path until I reached it. I reached the forest in which the blue dragon of Darendale resides.
You can really go on and on with your story, Thorn.
Of course, my life, it was 10,000 years ago that I had the curse. I fought the blue dragon with all my might. It merely scratched me, and the scratch was the curse. It grew and grew and grew until it covered my entire body. I hastily went back into my kingdom and called upon the goddess. The goddess who created Silverfloor.
And that is how you ended up here, Thorn?
Yes, I had bet the goddess for the crystal of eternity, the same ones that I am about to give to two teams. The crystal of eternity grants me immunity to the curse. I wanted immunity because I knew I could save my people. But, however, the curse quickly grew.
I hope your hopes are still high, contestants.
And so each team will be given a whiteboard for the tiebreaker round. Instead of writing on the computer, they will write on the whiteboard. The rules of the game are the same. Get the correct answer and get double the amount of points.
It seems we have finally got some answers about the way, Thorn. we will be playing a tiebreaker round, and all teams will be competing except Team P53, because Team P53 has already gotten first place.
Wow.
However, thank you. Please give a round of applause to P53. But also, I would like to tell the other teams to not lose hope, because this is your moment. However, this game, this round, will be a little different. We will be using whiteboards instead to answer the questions. But please make sure that you will only start writing once we say that the timer has started.
And now it would appear that the keyword is ready. Let's show the keyword.
The keyword is tie break.
What?
Yes, indeed. Well, it is the tiebreaker round.
Oh, of course, but shouldn't the keyword be a little more academic?
Well, I guess we'll see what the question will be about.
We will have to wait for that.
Or maybe this is the Divine Ones playing tricks on us.
Okay.
How about we move on to the question to see what this keyword is actually about? Let us see the question.
According to the pathologic description, what is the diagnosis? A liver biopsy with lymphocytic infiltration and epithelial injury involving the small interlobar bile ducts. Poorly formed epithelioid granulomas are also present in the portal tracts and are centered on bile ducts. Lymphocytic and granulomatous bile duct destruction is also noted.
Your 60 seconds may begin now.
You can start writing.
Seems like there has been a favorite.
You still have time for this question. Okay. The answer is?
And the correct answer is primary biliary cholangitis.
And now let's see who really got it correct. Let's see the scoreboard. And congratulations to Team UGM.
And Team P53. A big round of applause, please.
Congratulations for finally making it out.
Thank you all contestants for giving it your all in this round. And we wish the best of luck to the two teams who will be moving on to the next round.
In the next round, you will be guided across the seas by two sirens. Their names Morgan and Lolathia. I was once a comrade of theirs, and you shall meet them soon.
How about we say our outro again, Thorn?
Yes, we shall. And so fate has finally decided to remain where many fell.
Rare and delightful, you've danced with the abyss and returned with your souls intact.
Take your prize, heroes. Let it drown in the whispers of the dark.
And remember, it was we who gave you the light to outshine Death's shadow.
Now go, mock the grave while you still can.
For your time will come again soon.
Until we meet again, heroes.
And remember, the dead are always hungry and always here.
And so the next round will start at 1:50 p.m. We wish you the best of luck in the next round. You will meet the sirens, Lolathia and Morgan. Stay tuned to the next round. See you all next time.
Contestants may leave the stage and prepare for what's to come next.
Check, check. Hello, hello. 1, 2, 3, 4. 1, 2, 3, 4. You have come so far, and now for almost the final push. Travelers, where do your eyes wander? Perhaps it is on that one. She was once Lolathia, a siren with a voice of gold, but now she only sings of sorrow. Such is the fate of our clan. Once our voices danced amongst the waters. Then the curse came, smothering us in silence. Now we are but whispers on the tides. And the curse, it has taken her too. You would wish to help us. What could a traveler do against the curse that lingers within? Oh, I see. And there is only one way. Her soul is lost at sea. You must return it. Find the note to the siren's true song, and perhaps her memories will be recalled. And then, maybe, she will help you cross this cursed ocean. Are you sure? This could very well seal your fate. Follow me then.
Semi-final round. Call of the Deep Melody. This stage consists of 12 rounds. Each team must collect 5 musical bars, where one bar contains 4 notes. The lowest possible number of notes is 0. No negative notes are allowed. The goal is to collect all 20 notes by answering the questions correctly. At the beginning of each round, a randomized keyword will be displayed. After viewing the topic, teams will have 30 seconds to select the difficulty for the question. Easy. medium, or hard. Choose only one blessing to use for that question. Then, each team will be presented with a random short answer question based on their chosen difficulty. Scoring rules. Easy difficulty. 1 note will be given for each correct answer. If you answer incorrectly, you will not receive any notes and no penalties. Bonus. Answering 2 easy questions correctly in a row grants a blessing which adds 2 additional bonus notes. Medium difficulty. 2 notes will be given for each correct answer. If you answer incorrectly, you will receive 0 points, and there's a 50% chance of receiving a penalty by a wheel. If penalized, the team will lose 2 existing notes. Bonus. Answering 2 medium questions correctly in a row grants a blessing which makes the team immune to a penalty for the used round. Hard difficulty. 4 notes will be given for each correct answer. If you answer incorrectly, you will receive 0 points and a 2-point reduction penalty. If a team answers 2 hard questions wrong in a row, a 4-point reduction penalty will be applied. Blessing rules. Choose 1 blessing to use after selecting a difficulty. Each team may hold only 1 immunity blessing at a time, but may hold more than 1 plus 2 blessing. All blessings are consumed after use, even if the answer is correct. Winning conditions. The first 4 teams to collect all 5 musical bars will advance to the final. If no team reaches 3 bars by the 9th round, the requirement will drop to 4 bars. In the event of a tie, any excess notes earned beyond the required condition will be used to determine which team ranks higher. If the tie remains, any unused blessings will be converted into bonus notes. The plus 2 notes blessing will count as 2 bonus notes. The no penalty blessing will count as 4 bonus notes. The team with the highest total bonus notes from unused blessings will rank higher. If teams remain tied after this conversion, they will proceed to a tie-breaking round using the same rule. The first team to complete another musical bar will be ranked higher. Example. Round 1. This round has 8 teams. Each team chooses a difficulty for each question. Team 1 and 2 choose easy difficulty. Team 3, 4, and 5 choose medium difficulty. Team 6, 7, and 8 choose hard difficulty. The first 4 teams to collect all 5 musical bars will advance to the finals. Team 1 answers easy difficulty correctly and earns 1 note. Team 3 and 4 answer medium difficulty correctly and earn 2 notes. Team 6 and 7 answer hard difficulty correctly and earn 4 notes. Team 2 answers the easy difficulty question wrong and earns no notes in this round. Team 5 answers the medium difficulty question wrong and has to do a random ball draw, which gives them a 50% chance of receiving a 2-note deduction penalty. Team 8 answers the hard difficulty question wrong and immediately earns a 2-note reduction penalty. This is the scoreboard for this round. Round 2. Team 2 and 3 choose easy difficulty. Teams 4, 5, and 6 choose medium difficulty. Teams 1, 7, and 8 choose hard difficulty. Team 6 answers correctly and earns 2 notes. Team 7 answers correctly and earns 4 notes. Teams 2 and 3 answer wrong and earn no notes this round. Teams 4 and 5 answer wrong and have to do a random ball draw, which gives them a 50% chance of receiving a 2-note deduction penalty. Team 4 earns a penalty, while Team 5 luckily doesn't receive the penalty. Team 1 answers wrong and immediately earns a 2-note reduction penalty. Team 8 answers the hard difficulty question wrong twice in a row, and the 4-note reduction penalty will be applied. This is the scoreboard for this round. Round 8. Teams 1, 2, and 5 choose easy difficulty, with Team 5 answering the easy difficulty question correctly in the previous round. Teams 3 and 8 choose medium difficulty, with Team 8 answering the easy difficulty question correctly in the previous round. Teams 4, 6, and 7 choose hard difficulty, with Team 4 answering the hard difficulty question wrong in the previous round. Team 5 answers the easy difficulty question correctly and earns 1 note and a 2-note addition blessing. Team 8 answers correctly and earns 2 notes and a no penalty blessing. Teams 1 and 2 answer wrong and earn no notes in this round. Team 3 answers wrong and has to do a random ball draw, which gives them a 50% chance of receiving a 2-note deduction penalty. Unfortunately, Team 3 earns a penalty. Team 6 and 7 answer wrong and immediately earn a 2-note reduction penalty. Team 4 answers the hard difficulty question wrong twice in a row, and the 4-note reduction penalty will be applied. This is the scoreboard for this round. Round 9. Teams 2 and 3 choose easy difficulty. Teams 4 and 5 choose medium difficulty, with Team 5 using a 2-note addition blessing in this round. Teams 1, 6, 7, and 8 choose hard difficulty, with Team 8 using a no penalty blessing in this round. Team 4 answers correctly and earns 2 notes. Team 6 answers correctly and earns 4 notes. Teams 2 and 3 answer wrong and earn no notes in this round. Team 5 answers wrong and has to do a random ball draw, which gives them a 50% chance of receiving a 2-note deduction penalty. Luckily, the penalty doesn't occur, but a 2-note addition blessing will net them 2 notes this round. Teams 1 and 8 answer wrong, and Team 1 immediately earns a 2-note reduction penalty. However, the no penalty blessing of Team 8 saves them from receiving a penalty. Team 7 answers the hard difficulty question wrong twice in a row, and the 4-note reduction penalty will be applied. This is the scoreboard for this round.
I do admire this fleeting bravery of yours. So bold, yet so ignorant. Very well. I, Morgan of the Cursed Ocean, grant you both blessing and warning. Beware of your tongue, for every misspoken word tips the scales towards defeat. Choose well and speak wisely. Let it begin. Let's see the first keyword.
The first keyword is bones, joints, and soft tissue tumors. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. As the waters drown me, I can feel my memories fading away.
As a reminder, contestants, the harder the technical. Fortunately, we have a technical error. Don't worry, our teams are working to fix it as fast as we can. It appears our systems are as nervous as we are.
The curse has gotten to the internet as well, it seems.
I was cursed and trapped in the depths of the dark ocean, and here I am now.
It's isolating, isn't it? It's almost like it's cutting off our connection to the world and also internet connection. So while we wait for the error to be resolved, let me remind you again of the rules, because I do believe that was a very long video, right? So basically there are 3 types of questions you can choose to answer. The easiest one will net you 1 note if you get it correct, and no penalty if you get it wrong. The medium one will net you 2 notes if you get it correct, and you'll have a 50% chance of receiving a penalty. And if you do get it wrong, you get to go spin the wheel, so, it's not all bad. But the hardest question, which if you answer correctly gets you 4 notes, that's what, 1/5 of the way to 20? But if you get it wrong, you instantly lose 2 notes. Just a reminder of the rules.
Additionally, if you get 2 hard questions wrong in a row, you'll get the special penalty, which will deduct you 4 notes.
It's an entire bar. But as a reminder, you can't take from an empty glass, so you can't deduct from 0 notes. So maybe that'll come into play for some teams. And if you get 2 easy questions correct in a row, you get an additional +2 blessing. And for medium questions, if you get 2 of those right, you get a note protector, which is actually very useful. It protects you from any sort of penalty should you get it wrong.
As we wait, I'm curious, Morgan, where our
Yes.
travelers are from.
I am too.
Let's ask UPCM. Where are you from?
Philippines.
The Philippines. I heard it's a nice country.
Yes, I hear it's a beautiful place. You've been in Chiang Mai for a little while. Is this your first time here?
Is this your first time at Chiang Mai?
I also joined the CMU last year.
Oh, so welcome back. And we are sure that you're quite exhausted already. What have they done today? They've done the quarterfinals, right? Which I heard is quite long. And then some of the teams had the resurrection round, correct? I'm sure you guys are very tired, but don't worry. You are, I think, more than halfway there. Isn't that exciting? Well, since we're waiting for the technical error to be resolved, Inflammate, I really like your team name. Where are you guys from?
We are from Indonesia.
Is this your first time in Chiang Mai? How do you find it?
Chiang Mai is very beautiful city, and there is a lot of delicious foods.
I absolutely agree, and I think a lot of our students here also agree. And we heard that all sorts of years of medical students have come to compete today. I'm in year 2. What year are you in?
What year are you guys in for medical? I'm 3rd year.
I am a 4th year. I am 5th year.
So you guys have been, through the ringer, right? It's really hard. Everyone here is so smart. It's crazy. We were looking at the questions, and they're so hard. You guys are doing great. So our error has been resolved. So apologies, but let's see the keyword now.
The keyword for the first round is bones, joints, and soft tissue tumors. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. As I was saying, The isolation in the deep, dark ocean is truly frightening. Will someone come and save me?
We are plagued with conflict, and it appears there's more conflict? Oh no. We are so sorry, contestants. I think our technical team is just as tired as you all are. You know what? While we hope this error gets resolved quickly, how about, for 0 points, let's do a fun little riddle, right? How are you feeling about that, Lathia?
Sure, go ahead.
We used to love doing riddles before the curse came. Now we don't really do them anymore. So, for the audience, for the contestants, if you guys, need something to jog your brains, here's a riddle. I am not blanket, but I cover the ground. From the skies above I fall and I make no sound. What do you think that is? You have the answer? You can raise your hand from the audience, or, if you have nothing else to do here, you can raise your hands, or just keep it to yourself. Hey, you're right, good job.
Snow is indeed the correct answer.
Yes, a crystal falling with no sound. Lots of crystals in today's competition, right?
Indeed. I haven't seen snow in a while. Actually, I've never seen snow. I was in the ocean and
I've never seen snow either, Not to get meta, but like IRL, I've literally never seen snow. It would be exciting to see it. I mean, our contestants are so smart. I did not get that question on the first try. So, if you still have time, let's do another easy one, I think. I am full of holes, but I can hold water. What am I?
Does anyone know the answer?
You guys can keep thinking, don't worry. And if you are too shy to say the answer, just say it to yourselves and see if you're right.
Is it a teapot, Morgan?
It's not quite full of holes, is it?
Well, there's more than one hole.
I said full of holes, Oh, you're always so technical with these things. Jeez. And the correct answer for the riddle was a sponge. Haha. I think, are we back online? Yeah, we're back online? Okay. One more time for the first keyword, please.
And the first keyword is bones, joints, and soft tissue tumors. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. As a reminder, you will not be deducted any points if you get the question wrong. This only applies if you do not have any notes at the moment.
Your time is up. Your 60 seconds to answer begins now.
Time is up. Now, let us see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Now, let us see what our contestants have answered. Look at that, Morgan. The contestants are starting off with 4 contestants have started off with a hard question. Perhaps they are feeling bold.
Yes, they might be. And I don't know if you heard that, Lalathia, but I heard an audible gasp from the audience when the answers went up. So, I mean, well, but let's see who got it right and wrong. Oh dear. Now, as a little reminder, contestants, when the screen is up, and only when this screen is up, you may appeal the solution. But for now, it looks like every team choosing the hard question has missed the mark. But as they have no points, maybe they won't be deducted. So let's see in the scoreboard, shall we?
This is the scoreboard before grading. And this is the scoreboard after grading. We have on first place and second place, Team UPCM and Team NU1 with 2 notes. And on third place, we have Team MDCU with 1 note.
Seems easy and medium questions are getting answered correctly in this first round. But don't you worry. Not all good endings have good beginnings. So, you still stand, everyone still stands a fighting chance. Let's see the next keyword.
The keyword is skin.
We get really bad reception in the ocean. It's, assistant's kind of, fluttering back and forth. Okay, hopefully we can get the next keyword now, please.
Contestants, you may choose your difficulty level now. You may begin now. As this is only the second round, there are still plenty of chances for our travelers.
Yes, indeed. Everyone here stands a fighting chance to enter into the finals. As I said, you should choose wisely. Your time is up. Your 60 seconds to answer begins now.
Now let us see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Let's see what our contestants have answered. It seems 4 teams have chosen the medium question. Perhaps they are feeling a bit risky.
And 1 team choosing a medium question. Let's see if they are right. I saw that question. It was so long. Oh my God. And also 3 teams choosing the easy questions, which does not come with a penalty. A little revision of that hard question. It's a short story. It's literally a short story.
Perhaps the time you would have to take to read the question is longer than the time I have been trapped here.
Wow, yes. I mean, I've not got good reading comprehensions. I bet I wouldn't even be able to finish reading that question in, what, 60 seconds?
A difficult question indeed.
Yes. And now while we wait to see who's right and who's wrong, I have to say, our travelers have come quite far. I mean, they came all this way to come visit Silverfloor, only to find it struck by a curse of disharmony and also bad internet. Okay, but now let's see who got it right and wrong. Now, contestants, again, if you choose to appeal, you can do it in this screen. Otherwise, we invite the teams choosing the medium question who got it wrong to come down the stage and spin the wheel.
Can teams Inflammates, PKC, UGM, UPCM please send a volunteer to spin the wheel of fate?
This is our first and many wheel spins, actually. I'm excited to see what the ocean says.
I hope the tides turn in your favor.
As a reminder, you don't have to send everyone, but I guess you can go for emotional support.
Team UPCM will not be deducted any points.
That's some good luck over there.
Team PKC will also not be deducted any points. Team Inflammates will not be deducted any points as well. Unfortunately, Team UGM will have to be deducted 2 notes.
'Tis unfortunate, but not every chance that we gamble will we get away with scot-free on, right? But, so that was our first couple wheel spins. I'm sure our teams got very excited, right, Lalathia?
Indeed, I was also excited and I was also a bit nervous with them.
I mean, they are coming to save you after all. I would expect you to be nervous. You ever wonder how they got a spinning wheel into the ocean? So, just... Okay, but that's that. Let's see the scoreboard for the second round.
Here's the scoreboard before grading. And here's the scoreboard after grading. We have Team MDCU, UPCM, and U1 with 2 notes, and Team SI1 with 1 note.
Tis only the beginning of your trials, and I'm sure you face far worse than this. Please, you've come to help us this far. Hold on. Now, let's see the keyword.
And the keyword is breast. Contestants, you have 30 seconds to choose your difficulty level. You may begin now.
As a reminder, if you miss 2 hard questions in a row, you'll be deducted, I think, a full bar, right?
Yes, 1 full bar of 4 musical notes.
A unique kind of penalty for our hard question.
A little fish once told me, with high risk comes high reward.
Your 60 seconds to answer begins now.
Now let us see the correct answers. Here are the answers for the easy, medium, and hard questions. Let's see what our contestants have answered. It seems no teams have chosen the hard difficulty this time, Morgan.
Feeling a little less daring, dare I say. Don't worry, perhaps the middle road is a wise one. Also, just wanted to point out, we hear people audibly gasp when the answers come out. The anticipation must be crazy right now.
Whatever the answers may be, I am so glad that you have answered my call, heroes.
And looking at their answers, there are a few similar answers, so perhaps this time they will be able to collect more notes, bring you a step closer to earning your voice back.
Every note you collect brings me closer to my true voice.
And every note you collect brings me closer to admitting that I was wrong and that travelers can indeed help us.
I have faith in you, travelers.
I'm undecided, but they are certainly very smart and they certainly are very bold to have made it all the way here. And while we wait for the judges to grade these answers, Valathia, how are you feeling tonight?
I'm feeling a bit cold. The ocean is a bit dark and it has isolated me from the rest of the world.
Yes, it's actually really chilly in here, isn't it? I mean, I see all our contestants up here. Most people are wearing jackets. We're not. That's bad. But, you know, while we wait to see the scoreboard, let's see how people are feeling. This round seems to be quite tough. SI1, how are you guys feeling?
It's quite hard. It's quite hard, I think.
Yeah, I noticed. It looks really hard. You guys are doing great, I promise. What about you, UPCM? How's it going? How is it going? How are you guys feeling? Is it hard? Is it easy? Are you guys confident? No, I get a lot of giggles here. I totally get it. I mean, I don't get the questions, but I get the nerves. Oh my God, this seems so hard. And they actually told us before we came up here, they were like, these questions are really hard. And they were not wrong, am I right, Ilathia?
Indeed. I feel like our travelers up on the stage may be feeling a bit lonely.
Woo.
Let me ask them a few questions. Hello. Are you feeling confident?
I think we have like a 50% confidence for each question.
They said they have a 50% confidence.
Have a chance is as good as any chance, I guess. Do you want to see how other teams are feeling? I hear a lot of chatter up there. It's got to be nerve-wracking waiting for the correct answer, am I right?
Hello, Team UGM. Where have you come from?
We are from Indonesia.
Team UGM is from Indonesia. I've never been to Indonesia, but I think it's an interesting place.
And how is their team finding Chiang Mai or Silver Floor? Right, Silver Floor. How have you guys found it?
We find Silver Floor is pretty beautiful. There is beautiful creatures.
I'm glad Team UGM is finding Silver Floor beautiful despite the curse.
And with that, we're now going to see who got these answers right and wrong. Unless there are any appeals, we're going to have to ask the teams who missed the medium question to come up and spin the wheel. We need to ask for one volunteer, just so the wheel doesn't get too crowded. It needs room to breathe.
Unfortunately, Team NU1 will be deducted 2 notes.
Don't worry, it's only the 3rd round, actually, so everyone still stands a chance, in my opinion.
Team Inflammates will also be deducted 2 notes. It seems the oceans are not too kind this round.
Yes, sometimes the tides can be unexpected. But interestingly enough, no team's choosing the hard question. I mean, as the label says, the hard questions are really, really hard. But is it worth it? You could get 4 whole points for it. It's going to bring you so much closer to victory, right, Olathia?
Indeed. And as a reminder, if any team wishes to appeal, they may do so now. Perhaps the oceans will answer your call.
Now and only now for this question, contestants. But we're about to move on to the scoreboard.
This is the scoreboard before grading. And this is the scoreboard after grading. We have Team MDCU and Team UPCM with 3 notes.
Team UGM with 2 notes in 3rd place. And I can't quite see the screen, but I believe Team
PKC with 2 notes as well. Next we have Team SI1 with 1 note.
And the remaining teams still with 0 notes. But the game will keep going until a certain point. Either you defeat the curse or the curse defeats you. Now, let's see the next keyword.
The keyword is kidney. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. We are approaching the halfway mark of the competition. We will have 12 questions in total, travelers.
But if there are any complications along the way, those rules may or may not change. We'll announce it as we go, so don't worry about it and just choose a difficulty. Your time is up. Your 60 seconds to answer begins now.
Now let us see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Let's see what our contestants have answered.
Would you look at that? Now we've got some people feeling a little daring and choosing the hard question. Great risk, but potentially a great reward, right?
An even split between the teams who chose the easy and medium questions. Perhaps the simpler path is the way out.
It is albeit slow way out, because, one note. But still, there are no penalties for getting it wrong, so it's a valid choice, I think. So, I'm feeling pretty nervous. We're in the 4th round, or just almost halfway there, and the oceans, they have a way of throwing loops at you. I mean, entirely silver floor is very loopy and, hard to navigate. Am I right?
It seems the answers for the easy question are very similar to the answers provided by the oceans. My heart is filled with hope and joy now.
I really miss your optimism, and as much as I hate to admit it, I like that people of Silver are getting more optimistic because these travelers are here. Perhaps a helping hand is the road to freedom from this curse. And perhaps there's something we can take away, maybe some sort of common theme of this curse. What is it? Everyone's, fighting, right? And this, yeah?
Yes, and everyone is connected in a way. Perhaps the connection within your team will bring you to break the curse.
I mean, you say connected, but the people of Silverfloor are, fairly divided, right? I couldn't help but overhearing there's some sort of, red fairy. That was, from yesterday, but maybe it's nothing, right?
I haven't been outside from the ocean much, but I have heard of other species thriving in Silverfloor.
It's been so many years since we've seen someone else, some other sort of fairy. This curse is indeed isolating, and in dark times like these, I'm glad to have Lalathia around, and I'm sure our travelers are glad to have their teammates around while they are waiting, I'm sure, with bated breath to see whether their answer is correct or not.
Yes, and so many years indeed that I have heard a voice that is not my own.
That's freaky. But talking about connection and all that, let's, get a little bit meta. I think connection is important just in general and also, in med school because it's so hard, and other med students, it's really good to be friends with people because it's just a good energy, right?
Yes, indeed. And I believe the connection within each traveler's team will make them sail into the right direction.
Yes, perhaps through teamwork and understanding and communication will we find the path to freedom from the curse and, among other things. Since the answers are still being graded, I'm thinking some teams on, let's see, which team haven't we really spoken to? Lalathia, would you mind going on the stage and talking to some of our other teams so they don't feel lonely? Because, we're talking about connection. What's a little bit of conversation when I'm sure you're very nervous?
Team P55.
I think that's 53.
Hello, how are you feeling?
Good.
Team 55 is feeling good.
I'm curious. Why is that your team name? What does that say? P53? Who chose the team name? I'm just curious while we wait.
P53 is the guardian of the genome, so it's basically one of the main tumor suppressor gene, the protein one.
Honestly, I appreciate the little bit of creativity in the team names. They're fun. while we were going over who was coming to the semifinals, we were like, oh my god, there's so many creative team names, right?
Yes, and their full name is the Guardian of Genome.
That's certainly interesting. Let's see how MDCU are feeling, shall we? They seem a little lonely.
Hello, MDCU1. How are you feeling?
Feeling like we need to pray, keep praying and hoping we go steadily and steadily.
Thank you for the answer. We will also pray for you, and I hope the oceans are on your side.
Yes, please. If anyone's got any prayers for MDCU1 or, any other team, I'm sure everyone would appreciate it. Seems like our contestants are really fighting for their lives, with the wheel spins, the hard questions, and the number of rules in this competition. Just as a quick update, you see the keyword display time will be shortened a bit, so make sure you get a read or listen to my friend over there read the keyword. Okay, now let's see who got the question right and wrong.
So, Team Infomates, unless there are any appeals, please send a volunteer to spin the wheel of fate.
Yes. But let me point out, I think things are looking up, aren't they? Well, Hathia, it's a lot of green that I'm seeing.
Yes, and the green fills me with hope. Fortunately, the oceans are still on their side. Team Infomates will not be deducted any points.
Good for you. I'm, as much as you might not think so, I am rooting for every team here.
Are there any teams wishing to appeal?
You have a hand in the air?
Hello, we are SI1. We want to appeal for our answers. Since the questions didn't specify the type of the cells and the location of the cells, the origin cells of the tumor, and we also think that the intercalated cell is also a type of renal tubular cell. So we think our answers should be reconsidered. Thank you.
Thank you for your appeal. The renal tubular cell is too broad because we have the proximal convoluted renal tubular cell, distal renal tubular cells, collecting duct and collecting tubule. So it's too broad. We have specific answer. We would like you to answer the most specific answer.
So it appears, I believe the appeal was not considered, correct?
Yes, but thank you for the appeal nonetheless.
Yes, your self-advocating is good. It's good. Are there any other teams wishing to appeal? Well then, let's move on to the scoreboard.
Here is the scoreboard before grading. And this is the scoreboard after grading. We have Team PKC on first place with 6 notes. Following in on second place, we have Team MDCU and Team UPCM with 4 notes.
And I believe UGM with 3 notes.
Next, we have Team P53 and Team NU1 with 2 notes.
And while the remaining team still has no notes, we are, I believe, a little less than halfway through our competition, right? And we've got a team almost at the halfway mark to 20 notes. How exciting. So, without further ado, let's see the next keyword.
The keyword is liver and gallbladder. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. Remember, if you have any blessings at the moment, you may use them now. And use them wisely.
If any teams are holding on to a note protector blessing, let me remind you, you can only have one of those at any given time. Your time is up. Your 60 seconds to answer begins now.
Time is up. Now let us see the correct answers. Here are the answers for the easy, medium, and hard questions. Now let's see what our contestants have answered.
A surprising answer for the easy question. And one team choosing the hard question, one choosing the medium question. It's very interesting.
There seems to be a myriad of possibilities of answers for the easy question.
I see. We have teams, I believe, praying, hoping their answer is correct. We hope your answer is correct too.
Yes, we are on your side, travelers.
I mean, the ocean is unpredictable, and it may not be on your side sometimes. But we do hope that you collect your notes and help us break the curse. And let's see who got the questions right and wrong. Would you look at that sea of red? If any teams wish to appeal, please do so on this page.
Are there any teams wishing to appeal?
Hello. Based on the answer key, one of the answers is beta-catenin activated hepatocellular adenoma, and our answer is CTNNB1, which is also beta-catenin, and we are trying to appeal that. And I'm not sure if our answer is seen on the page, but I can't see our answer on the page, but I think it's CTNNB1, which is also in the book. Thank you.
Thank you for your appeal, but the question asks you to answer in full name, not abbreviation. Please be careful. If you can answer in abbreviation, we will have the... Or what? Your answer is CTNNB1, right?
Sorry, it's not the abbreviation. It's because it's asking the molecular subtype, and CTNNB1 isn't really an abbreviation. It's more of the gene that corresponds to beta-catenin, which are both molecular. If that's the point of the question, because it wasn't like, if it's alright, we can go back to the question.
But the full name of this type is beta-catenin activated. You have to add the answer activated. CTNN is a genetic, it's a gene, but the subtype is beta-catenin activated subtype, according to Robbins' pathologic basis of disease and WHO classification.
Thank you, sir.
It appears that despite their appeal, the question will still be marked as wrong. So let's see the scoreboard.
This is the scoreboard before grading.
And the scoreboard after grading will arrive in a moment. There it is.
We have Team MDCU on first place with 6 notes, and Team PKC and Team UPCM following with 4 notes.
Moving forward, let's see the next keyword.
The keyword is blood vessels. Contestants, you have 30 seconds to choose your difficulty level. You may begin now.
Here we are at the halfway mark. But the tides can turn at any time, so I ask you to stay on guard. And for those of you who are feeling discouraged, like I said, things can change at any moment. Hold strong, travelers. Perhaps you'll be the one to break the curse after all. Your time is up. Your 60 seconds to answer begins now.
Time is up. Let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Let's see what our contestants have answered.
Once again, we have the majority of teams choosing the easy question. Maybe one step at a time is the way to take it.
And it seems the answers for the medium questions are exactly like the answers provided by the ocean. I'm so proud of the travelers.
So while we wait for the answers to come through, oh, and they have. Let's see who got it right and wrong.
Good job, travelers. Fortunately, no one will have to spin the wheel of fate this round.
Yes, fortunately, no one will be spinning the wheel. And there is, in fact, I noticed a lot of green. I think it's half and half, right? People getting it right and wrong. But now, let's see the scoreboard.
Here's the scoreboard before grading. And here's the scoreboard after grading. On first place, we have Team MDCU with 8 notes. That's 2 musical bars. On second place, we have Team PKC with 5 notes and Team UPCM with 5 notes.
And on to the next. We are more than halfway through, considering this question. So let's see the next keyword.
And the keyword is gastrointestinal tract. Contestants, you have 30 seconds to choose your difficulty level. You may begin now.
Any blessings also may be used at this time. Keep in mind you can only use 1 blessing at a time.
And you may not keep a notes protector blessing more than one blessing at the same time, but you may stack your +2 notes blessings.
I see strategy may also be essential to this game. Your time is up. Your 60 seconds to answer begins now.
Time is up. Let's see the correct answers. Here are the answers for the easy, medium, and hard questions. Let's see what our contestants have answered. Once again, it seems no teams have chosen the hard questions.
It seems playing it fast and hard may not be the key to this round. And most teams agreeing that the easy question may be better and yield better results, right?
And whatever path the traveler chooses, I hope the winds guide them in the right direction.
And we're hearing a lot of discussion even amongst the audience and amongst the contestants. I'm sure these questions are quite hard and, everyone's anticipating what's going to come next. Now, let's see who got it right and wrong. It appears we have teams spinning the wheel already, correct? Lolathia, what are the results of those spins, please?
It seems both teams have been deducted 2 notes, unfortunately.
I see. It seems the ocean is relentless, and it can sometimes be quite harsh.
Yes, but we are on round 7 right now, and we still have 5 more rounds to go.
Well, this game could change at any time. Let's see the scoreboard for this round, please.
Here is the scoreboard before grading. And here's the scoreboard after grading. Team MDCU is still on first place with 8 notes.
Lots of discussion as to strategy, I'm sure. Now, let's see the next keyword.
And the keyword is I. Contestants, you have 30 seconds to choose your difficulty level. You may begin now.
More than halfway through, and our contestants are probably feeling quite nervous right now. Remember, we set the bar for 20 notes to say my dear friend and have her guide you across the ocean. That even be reached? Is it even possible at this point?
I can already feel my true voice returning, Morgan.
Perhaps. But your time is up, and your 60 seconds to answer begins now.
Time is up. Now let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Let's see what our contestants have answered. It seems Team P53 is the only team choosing the hard question.
And I'm sure it's quite a hard one. And it seems the path has been set. The easy questions are probably the ones people are asking for the most, right?
Perhaps the travelers are using some sort of strategy right now.
Yes, well, strategy is required just as much as wit to win this game. Now, let's see who got the questions right and wrong.
Well, unfortunately, Team Inflammates will have to send a volunteer to spin the wheel of fate.
And we know, sometimes this can be discouraging.
I hope the tides turn in your favor. And yes, Team Inflammates will not be deducted any points this round.
Let's see the scoreboard for this round.
Here's the scoreboard before grading. And this is the scoreboard after grading. We have Team PKC and Team UPCM tying with 9 notes. On third place, we have Team MDCU with 8 notes.
Thank you to the audience for the encouragement. I'm sure our teams competing absolutely appreciate it. They can use all the help they can get at this point. Now let's see the next keyword.
And the keyword is heart. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. You have come so far, travelers. I truly admire your effort and bravery. As a reminder, you may use any blessings you possess at this moment.
Strategy and wit, that is what it takes. Your time is up. Your 60 seconds to answer begins now.
Your time is up. Let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Now let's see what our contestants have answered.
And now the answers have been split. Most teams choosing either medium or easy questions.
And Team Inflammates, the only risky team, choosing the more treacherous path.
So let's see if that pays off. Let's see who got it right and wrong.
Well, unless there are any appeals, Team MDCU, NU1, P53, UGM, please send a volunteer to spin the wheel of fate.
1 volunteer per team, please. The wheel needs room to breathe. 1 volunteer.
Team NU1 will not be deducted any points. Team UGM will be deducted 2 notes. Team MDC will not be deducted any notes.
Seems the oceans are brutal, aren't they? Our contestants have suffered blow after blow of difficult questions and misfortunate wheel spins, but we are right there with you, because if you don't free us from this curse, we're just gonna stay here. So, let's see the scoreboard for this round.
Here is the scoreboard before grading. And this is the scoreboard after grading. Team PKC and Team UPCM are tied on first place with 10 notes. On third place, we have Team SI1 with 9 notes.
Competitors, I hear something changing. The rules have changed for this game, just a slight bit. From now on, the number of notes you need to be able to move on to the finals have been reduced to 16 notes instead of 20. 16 notes to move to the finals.
That is 4 musical bars.
And that may be encouraging to some of our contestants.
It seems the oceans are still kind to our travelers.
Maybe they will, help us find our way out at last. Maybe it takes a helping hand to be free from something so terrible as this curse.
And travelers, I promise you one thing. If you help me break this curse, I will guide you across the sea to your next destination.
And I wonder how our teams are feeling about that rule change just now. So we changed the requirements from 20 to 16 notes. How are the inflammates feeling?
I think it's just okay. Yeah.
I know, these rounds can be quite discouraging, can they? But, again, we're really right there with you, and we hope that you guys catch some luck next turn. What about SI1? The rules have changed. Do you think your chances have changed?
Yeah, I think it was a very heart-wrenching moment, but it was great. We try to maintain the position. Thank you.
Well, we're wishing you the best of luck for our next question. So, let's see the next key word.
Contestants, you have 30 seconds to choose your difficulty level. You may begin now. As we've said, travelers, the reason the rules has changed has already been mentioned in the rule book. So, to remind you, the requirement has dropped from 5 bars to 4 musical bars.
And that brings us ever so closer to crossing this ocean on the way to the finals. And I wonder what awaits you there. Your time is up. Your 60 seconds to answer begins now.
Time is up. Let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Let's see what our contestants have answered.
It appears that the lower threshold of points needed has made our contestants a little bit bold. We have 3 teams choosing a hard question, and I hope they know what they're doing.
And it seems a lot of the teams are choosing to use their blessing this round. Remember, you should give it all you've got as we are approaching the last rounds of this adventure.
Yes, as it comes to an end. If you have any plays to be made, play them now.
Team UGM will be spinning the wheel of fate.
And let's see who got these questions right and wrong.
Fortunately, they will not be deducted any notes.
And that is a tough blow to those feeling bold and choosing the hard questions. But any risk worth taking, right?
Can I speak? Or is it not?
So, let's see the score. We have a team appealing.
We would like to appeal acute promyelocytic leukemia since it also presents with our rods and phagot cells as in the image, and it's also a type of AML, and it also is more characteristic of the phagot cell that's seen in the image with the our rods that are in the cell. Thank you.
For APL, okay, the morphology of the blast, you usually have a bilobe nuclei, and this one is a myeloblast. Is that okay?
Unfortunately, their appeal has not gone through.
Still, I admire your bravery, travelers. Thank you for the appeal.
Now, let's see the scoreboard for this round.
Here's the scoreboard before grading. And here's the scoreboard after grading. On first place, we have Team PKC with 13 notes. On second place, we have Team UPCM with 12 notes. And on third place, we have Team SI1 with 10 notes.
I must admit, I may have judged you too harshly in the beginning. Maybe you are a key to helping us break the curse. We are ever so close to the end of the game. So, let's see our next keyword. Which will arrive in a moment, I'm sure.
The keyword is being washed ashore. Please wait patiently.
And while we are waiting, I'm not sure how long this keyword is going to come, so let's jog our thoughts just a little bit for the audience. Here's another riddle. I have so many of them.
You are so full of mysteries, Morgan.
And I am a mysterious woman. So, for fun. What number? Oh, actually, no riddle. Let's see the next keyword.
The keyword is lung. Contestants, you have 30 seconds to choose your difficulty level. You may begin now. We are on round 11. Only one round left before we reach the end of the adventure.
And we do have a team that is coming close to the threshold of 16 notes to cross the ocean. It is sink or swim at this point. Your time is up. Your 60 seconds to answer begins now.
Time is up. Let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Now let's see what our contestants have answered. It seems no teams have chosen the medium question this time.
It is either go easy or go hard, and we, as the answers were revealed, we saw some, hands going up in the air. So let's see whether the easy or the hard road is the way.
I also saw a few teams using their blessings this round.
Yes, very strategic use of your blessings nearing the end of the game at the 11th round. Should I say the 11th hour? And the tension is in the air, everybody, as we wait to see who gets these answers right or wrong. These hard questions, I'm sure our players are feeling risky, or perhaps this is a Hail Mary. One last shot to make it through the finals.
What is a Hail Mary, Morgan?
It's basically like a last move. It's a last-ditch effort to complete something. That's what I think it is, at least.
I see.
While we wait for the answers, I'm sure our contestants are feeling nervous, so we will spare them the pressure of asking them any more questions. I mean, I'm nervous for them, and I'm sure that they have, support in the crowd. We've heard some claps every now and then, right? Again, on behalf of them, I guess. We're very thankful that you're here and watching us and giving us support.
To remind you of the rules, it seems the answers have been provided.
So let's see who got it right and wrong. Seems these last-ditch attempts may not be paying off quite the way they planned. Unless they've used a blessing, of course, then their standing will remain with no additional gain of point.
Are there any teams wishing to appeal?
If there aren't, then we are on our way to see the scoreboard. Maybe this playing it hard and fast option is, But who am I to say? Let's see the scoreboard.
Here is the scoreboard before grading. And here is the scoreboard after grading. We have Team UPCM on first place with 15 notes. Following in on second place, we have Team PKC with 14 notes. And on third place, we have Team SI1 with 12 notes.
Can you feel the curse leaving you, Lolathia?
Yes, I can already feel the sunlight shining from above the surface.
And now we are moving on to our final question. If you have any blessings, this is the last round where you can use them. So, be wise, be risky, or take it easy. It's your choice. Let's see the next keyword.
The keyword is head and neck. Contestants, you have 30 seconds to choose your difficulty level. You may begin now.
As a reminder, this is the last question. If you want to use any of your blessings, you can use them right now. But who am I to tell you what to do?
In the event of a tie, any unused blessings will count towards your final score.
Your time is up. Your 60 seconds to answer begins now.
Your time is up. Let's see the correct answers. Here are the correct answers for the easy, medium, and hard questions. Now let's see what our contestants have answered.
Coming up to our last round, just having seen the answers, we are hearing commotions from the audience, commotions from the competitors. Let's see, because this round will decide who goes on to the finals. I bet everyone's excited. I sure am.
I am excited too, and I'm so proud with how far you've come, travelers.
Indeed, the road here was treacherous, and if you are standing here right now, you are brave and you are witty and you are done such a good job. So, let's see who got the answers right and wrong.
It seems evenly split. Half of the travelers have gotten the answer correct and incorrect.
Unless anyone would like to appeal the answers, this is the last time for you to be able to appeal within this round.
Are there any teams wishing to appeal?
If not, we are on our way for the scoreboard to see who makes it out and who stays here with us.
Yes, and we are so close to breaking the curse, travelers.
So, let's see the scoreboard.
Here's the scoreboard before grading. And here is the scoreboard after grading. We have Team PKC on first place with 16 notes, Team SI1 with 16 notes, Team UPCM with 16 notes as well, and following on fourth place we have MDCU with 10 notes.
Now, we wait for the final scoreboard where we will confirm exactly who passes on to the finals.
Thank you, travelers, for answering my call.
Let's see the final scoreboard.
Congratulations to Team PKC, SI1, UPCM, and MDCU.
You will be continuing to the finals. And has something changed over there?
I never thought my voice would return. For so long, I believed it lost. Yet through your kindness, your choices, and your will to learn our tongue, you have returned it. I can sing again. From the bottom of my heart, I thank you, teams. You have shown that even the deepest curse can be broken. There is hope for our clan. Hope that we may rise from silence together. And now, as promised, I will guide you across the sea. Over there, you will finally find what you seek, the roots of the curse and the beginning to the cure.
Thank you very much. This has been the semifinals. And competitors, you are excused. In 15 minutes, the finals will begin. You may leave the stage.
โ
Contestants, please come up to the stage. Check. Courageous travelers, I am Janesta Silverfloor, last of the woodland fairy line. Once, these forests breathed gentle magic, but when the rift grew between Florids and Earthlings, shadow crept into every glade, every stream. The villages above the spire, once havens of safety, now lie drowned in despair, hearts bound by a seething curse. Yet still, the wild heart of this land stirs in me, and you, outsiders, wildcards, may yet breathe hope into Silverfloor.
So, still it's the deep glory, come, step inside. Please, we experience past legends twisted us into villains, but we obey. Only our loved ones alive. The demon queen holds our kins hostage, draining us with every thought of deviance. But you, untouched by the curse, you are our last and only hopes. Take this, a knowledge for your journey, a clue to tip the scales in your favor. Remember, contestants, you have 10 minutes to choose your labs. However, we will immediately move on if everyone has locked in their choices before 10 minutes. Are there any questions? Please, do not betray our trust. Our faith in you is all that remains. Soft uncertain like dying embers. Only you can restore the hopes to Silver Floor and show us there is mercy beyond these walls.
So, the little heroes crawl to my throne. How quaint. Did you come to mend Silver Floor, or to steal its heart, as your kind always has? Fools. You are no saviors, only fools draped in courage. Once I was Silver Floor's queen, its heart, its voice. I trusted mankind, and I gave freely the forest's lifeblood. But betrayal is the cruelest blade. Your greed shattered our bonds, and my gifts became curses. And yet, here you stand, daring for redemption. No, better a cursed forest than a land betrayed again. So, come then, face me, endure the wrath of a queen betrayed, and let this trial decide Silver Floor's fate, peace or chaos eternal. But before we begin, let's see the rules to the finals, shall we?
Final round. The final round consists of 4 teams. You will play 3 clinical cases. Each case will have 3 phases. At the start of each case, the case scenario will be displayed on the screen for 60 seconds. The ancillary test table will then be displayed with a list of available tests for 60 seconds. Both the case and the table can be reviewed on the screen throughout the case. Phase 1. Gathering the fragments of the Holy Sword. Each team will go through 4 multiple choice questions in each clinical case. For each round within this phase, a randomized keyword will be reviewed. The question will be displayed, and the quizmaster will read it aloud. Teams will have 60 seconds to respond. If the answer is correct, the team will receive 1 point. If answered incorrectly, the team will not receive any points. Following Phase 1, teams will be ranked based on their total accumulated points. The highest score, designated as X, will determine the number of fragments corresponding to each rank as shown in the table. Teams with the same score will be assigned the same rank. The fragments earned in Phase 1 will be used to conduct ancillary tests in Phase 2. Phase 2. Exchange fragments for ancillary tests. The case scenario will briefly reappear to refresh the context for 45 seconds. Then, the team will have 6 minutes to use the collected fragments from the previous phase to conduct an ancillary test to help the team understand the case scenario more thoroughly. Phase 3. Use ancillary tests to answer the case-related question. In the final phase of each case, your team will answer 5 short answer questions related to the clinical scenario. You may refer back to the unlocked lab results at any time while crafting your answers. All 3 clinical cases will proceed in the same way. The team with the highest total points, which is the combined score received from all cases in Phase 3, will be deemed the champion of the 10th Chiang Mai University International Medical Challenge.
Contestants, are you ready? If so, we shall begin.
Let's begin with the first case study.
As a reminder, contestants, you have 60 seconds to review the case lightly. Such a long case, isn't it, Janesta?
Yes, it's as long as our history.
Right. Are there any reminders that we need to give our contestants?
One reminder that I would like to give you all is that even though after showing the correct answer and you get the incorrect answer, you will still have the chance to appeal in the stage that we will tell you later. So don't lose hope if you didn't get the correct answer in the first place.
Correct, Janesta. And to our audience, is there anything that you would like to remind them?
Well, just stay seated and enjoy the show.
Correct. But how many phases are there in one case?
Oh, so there are 3 phases, and there's so many sub-questions in each, so just enjoy and yeah.
Right, which means they have how many sub-questions?
So there are 4 sub-questions, and in phase 2, there will be 5 sub-questions the contestants have to answer. And in total, there are 3 case studies, so that will be a lot of work.
Correct. A lot of places to earn points and to also lose them. I believe our time is done. Let us move on to the list of labs. Talking about the list of labs, how do we gain those labs, Janesta?
Well, in order to gain those labs, you will need fragments in order to buy them. So to gain the fragments, you will have to get high points, 1 point for 1 fragment. So that means the more points you have, the more fragments you will get, and the higher position will you be in this game.
It's not only a list of who answers the question best, but it's also a test of wit, of critical thinking and skill. Is that correct, Janesta?
Yes, indeed. And also, even if you have the most fragments, please do not underestimate other teams because they will still have the chance to buy the same fragments, even though less than you guys, but they might get the right one, and that might be beneficial for answering the question.
Correct.
And now, the time is up. We will now begin phase 1.
Right, but before we begin phase 1 and while we're waiting for the keyword, is there anything that you would... Oh, excuse me. I believe that the keyword is ready. Is that correct, Janesta?
Yes, so let's see the keyword of the first question. The keyword of this sub-question is blood vessels.
Now, let's show the question.
A skin biopsy reveals the histopathology changes shown in the picture. H&E stain medium magnification. Laboratory tests reveal HBs antigen negative. Anti-neutrophil cytoplasmic antibodies are positive. Which of the following is the most likely diagnosis?
Contestants, your 60 seconds begins now.
You have 30 seconds left. So now time is up. Let's see the correct answer.
And the correct answer is microscopic periarteritis.
And I believe, let's see our participants or our contestants' answers.
Wow.
We're off to a good start with teams MDCU, SI1, and who else got correct?
PKC. So in total, there are 3 teams that got it correct, and only 1 team that didn't get the correct answer. And now we'll see who got it right and wrong. Well, as expected, only 1 team got incorrect answer, while the other 3 teams ended up with the right one.
I would also like to remind our contestants, if you feel the need to appeal, please do so now. Once we move to the scoreboard, there is no more appealing. Right. I believe there are no appeals. So let's move on to the scoreboard, shall we?
So now, there are 3 teams that are tied in the first ranking, MDCU, SI1, and PKC with 1 point equally. And the rest has 0 points.
Right. How perfect is that, isn't it? Off to a great start, are we?
Yes, that might mean it might contain some hints in the question that hinted our contestants.
Right, but our contestants have only 3 more sub-questions to go, is that correct?
Yes, so now let's move on to the keyword of the next question. The keyword of this sub-question is head and neck.
Let's show the question.
Which of the following is the characteristic histopathology of esthesioneuroblastoma?
Contestants, your 60 seconds starts now. I believe that even the fate of time doesn't want us to continue our game. Well, while we're waiting for an answer from the higher heavens, what is your take on the competition, Janesta? How are you feeling right now?
Well, I'm very nervous because it's really challenging, and I must admit that even I myself cannot answer these kind of questions. But I really hope that our contestants are qualified enough to answer all the questions and come help Silver Floor from you, evilness.
Right. But I feel like our contestants might have some test day jitters. So, should we go and interview them?
Yes, sure.
Janesta, would you be a dear and go up and interview them? Thank you.
Sure. So let's start with the closest team to me here, July 1. So can I ask you guys how you're feeling right now? Are you confident that you're going to win?
Not at all.
As we've mentioned before, praying. Praying is everything for this competition.
If prayer is the way to win this competition, I fear that your choice of contestants is a bit sketchy now. Janesta.
No, do not underestimate them because I just believe they are humble. But would you like to hear some other opinions from the other team?
Of course, we have 4 teams. Why not go ahead and interview all of them?
Yes, so How about Team SI1 here? So can I ask you, how did you feel with the previous rounds of the questions? Were they hard? Were they challenging?
I feel like my team is like a roller coaster. That I got the 0 point at like 7 questions, but we can go to the finally.
We might have found the underdog to our competition, right, Janesta?
Yes. So it shows that even though at first they didn't do very well, but eventually it turned out fine.
Right. And how about Team Undiagnosed Plasma Cell Myeloma, or UPCM? How are you feeling right now?
So I think expectedly nervous about the final round.
Great. Thank you for your opinion.
Well, I would like to continue with the interview, but right now we're going to continue with the next sub question. And for this one, every team will get 3 points. So now we'll show the keyword of the next sub question. However, while waiting, would you like to tell your story about why you just suddenly appeared out of nowhere?
Of course, I didn't just suddenly appear out of nowhere. I was here right from the beginning. Didn't you notice, Janesta?
Well, no. You were no one in my eyes. So.
Wow. But I was here because I heard that there was not a competition filled with knowledge and friendship. And that got me thinking, how could that be when the humans have betrayed my own kind thousands of years ago? Of course, I had to come and see what all of this was about and whether these heroes would even make it to my throne, which in the end they did. And they came with a total of 4 teams, so that was surprising indeed. Of course, that's why I came, to see for myself who would be the victor and who would surpass me.
I've heard a bit from Corvin that back then in Civil Floor, you used to torture all the animals and kill all the creatures and maybe abduct some people. Is that true?
Do you always believe what other people say, Janesta?
Well, from the look of you, yes.
Right, but in the end they say do not judge a book by its cover. Remember that I was betrayed by humans, not the other way around. That must have meant that I had a heart that was filled with gold before this, correct?
Well, that's not always the case. And right now, because we have some extra time, I would like to interview the one team that we haven't interviewed yet, which was UPCM, right?
Oh, I believe we have already interviewed Team UPCM. However, we haven't interviewed Team PKC. So, Team PKC, I would love to hear your thoughts on how you're feeling in this competition. How are you feeling? Do you feel like you can match up to your competitors?
We are feeling great and yeah, like we are so proud to be one of the among us in the competition. Yeah, to join. Thank you.
Thank you so much. Are there any words that you would like to give to your friends or to your university? Team PKC? Would you like the question again? I believe that not even this team of humans would listen to a queen. Anyway, I was asking, are there any words that you would like to give to your friends and to your university? Any last farewells, last reminders? Anything you would like to say to them?
You're gonna make it.
And this is their last team's final words, everyone.
Well, I would say they're very kind.
And Janesta, do we still have some time left?
Yes, we still do have a lot of time left.
Oh, unfortunately so, right? Well, we have 4 teams and we have already interviewed all of them, so shall we turn our attention to the audience?
Yes, so we would like to interview one human from the crowd. Which one?
Janesta, you choose. I'm totally fine with either. Okay, maybe I'll choose then. Let's see who's here. I believe let's interview this lovely trio right here. I would like to ask you, are you rooting for anybody in particular up in those 4 teams? Any one of you is fine.
Well, from the other university, yeah, the one who lost in the first round. Yeah. But I'm still here for watch who is the winner.
Wow.
Wow, an uncertain answer, isn't it? So they're not rooting for any team in particular, but the team who's going to be the winner. So, contestants up there, make sure that you win.
Yes, and let's waste no more time and see the scoreboard. So, as I said before, all the teams got the points in this round. So, all the rankings are still the same, with 3 teams tied in the first ranking: MDCU, SI1, and PKC with 2 points.
Great. Now, are we ready to move on to the next sub-question?
I believe we still have a bit more time left. So, let's talk about your origin, Queen. Why have you become so evil?
Well, as I've said before, many times, Janesta, I became an evil queen due to mankind's betrayal. I wasn't like this 1,000 years ago. I was just like you, an innocent and carefree fairy who was willing to do whatever she pleased, but not so anymore.
And I would like to see how far you will go. So now let's move on to the keyword of the next sub-question. And for this question, the contestants, please use the whiteboard. The keyword of this sub-question is kidney.
Let's show the question.
A 25-year-old man presents with oliguria. Physical examination showed blood pressure 160 over 100 millimeter of mercury and pitting edema of both legs. Urinalysis shows protein 4 plus and dysmorphic red blood cells. Renal biopsy stained with silver stain is shown in the picture. Low magnification. Which of the following is the histopathologic finding in this patient?
Contestants, you have 60 seconds. Your time starts now.
You have 30 seconds left. And time is up. Now let's see the correct answer.
And the correct answer is lobular gomolar accentration.
Now let's see our participants' answers. So teams PKC and UPCM are correct. Teams SI1 is correct. And team MDCU1 is incorrect.
Unfortunately. So, now that the judges have already finished checking the answers,
shall we see the scoreboard?
Yes. So, scoreboard please. So now, from the previous rounds, there were 3 teams that were in the first ranking, but for this round, only 2 teams are now first, which are SI1 and PKC. Congratulations. And this is followed by UPCM and MDCU.
Congratulations, we are nearing the halfway mark for the phase 1 of case 1. Okay, so while we're waiting for the answers to be finalized, let's discuss amongst ourselves again. Well, we have Angel Sophia by our side. I would like to ask her, what does she think of the difficulty level of the questions that we faced just now?
First of all, thank you for greeting me. I afraid that Evil Queen wouldn't greeting me. Long time no see, Evil Queen.
Thank you.
Okay, the difficulty of this question. Actually, there is a final round, right? So all the question is so tricky. If you get the point, you're doing great job. But if you feel so worried about that you didn't get the point, it's okay because all the questions are hard.
Yes, I agree. So now let's move on to the keyword of the next sub-question. The keyword of this sub-question is immune and skin.
Okay, let's show the question.
A 25-year-old woman presents with a facial rash and a sign of renal failure. Her anti-nuclear antibody is positive, peripheral pattern. A skin biopsy shows liquefactive degeneration and atrophy of the deep epidermis. Which of the following is the most likely immunofluorescence pattern of this skin lesion?
Contestants, you have 60 seconds and that begins now.
Heroes, you have 10 seconds left. The time is up.
Contestants, please raise your whiteboards as the judges appraise your answers. Now I will announce the participants' answers and their and whether they got it correct or not. Team PKC got it correct. Team UPCM correct as well.
Team SI1 correct. And Team MDCU1 also correct.
Congratulations, teams. You're all going strong.
Yes, and it's very surprising and very rare to see a round that all the teams got the correct answer. It might mean that the question might be easy or the contestants have already stepped up their game.
Who knows? It might be both. Now, are we ready to move on to the next phase, or do we still have some time?
I believe we still have some more time. So, let's talk about something else.
How about we interview the contestants and see how they're feeling right now?
Yes, so will you choose one of the team, please?
Okay, this team's very close to me and very cheeky last time, so Team PKC, how are you feeling now that you've answered a lot of the questions correct?
We all feel great, but still nervous a little bit. Yeah.
Okay, a little humility. So let's move on to the scoreboard, shall we? So we have Team SI1 with 4 points. How about the rest, Janesta?
And for PKC, you also have 4 points equally. However, for MDCU and UPCM, you have 3 points. Only 1 point lower than the other 2 teams. So don't lose hope just yet. And I can see here that there's a team that has stepped up their game because in the last round they ranked the lowest, but for now they're equal to the other teams. So great job, you guys.
Right, I am excited to see the fragments, aren't you?
Yes, so let's translate each team's point into fragments.
So we have Team SI1 with 7 fragments, which equates to points where you can choose labs. How about the others?
And for PKC team, you also have 7 fragments, the same as SI1. For MDCU and UPCM, you all have 5 fragments that can be traded for lab results.
Perfect. Are we ready to move on to the next round?
Yes.
So we will now begin phase 2. Contestants, you will have 10 minutes to choose your labs. However, if all 4 teams choose before the 10-minute time limit, we will move on. And your time should start closely now, but
yes, but before choosing the lab, we will now review the case, and you have 45 seconds.
Oh, of course. Thank you so much, Janesta. Right, we still have 1 phase to go before we start phase 2.
Ten seconds left.
Right, and our time is up. So now this is the time where we will be looking at our labs, and this is now phase 2.
Yes, so contestants, you have 10 minutes to choose your labs. And as a reminder for all the contestants, so as soon as you choose your labs, you will get the lab result immediately. So that means the slower you choose your lab, the slower you get the lab result too. So please use your time wisely. And a little note for the contestants, you have to use up all of the fragments that you have, or else you will not get the lab results.
Time is ticking, contestants. I believe that our lab results are all in, correct, Janesta?
Yes, so we'll continue with the next stage, which is what, Queen?
We will now begin phase 3. And phase 3 has 5 questions in which the contestants have to answer within 7.5 minutes. Are we allowed to begin?
Yes.
Okay then, so contestants, your 7.5 minutes begins now.
30 seconds left. Time is up. Now that all the contestants have already locked in their answers, let's see the correct answer of each question. The correct answer of question 1 is
antigomular basement membrane disease.
Let's see what our contestants answered. Wait. Janessa, what did Team PKC answer?
Well, it's something that I, as a Florian, don't know, but it's definitely something that's different from the other 3 teams, right, Queen?
You are correct. That actually does look different from the other teams. Well, are we still waiting for the judges?
Yes.
Okay, perfect. Then while we're waiting for the judges, let's look at each answer in detail, shall we?
Yes.
Angel Sophiel, would you mind giving us your opinion on these 2 different answers?
Well...
Oh, sorry, Angel Sophiel.
Oh, why are you so mean to Janessa like that, dear Queen? You
I'm a
already
little
said
hurt.
the name. It's okay, right, Janessa? For the PKC team, they answered type 1 rapidly progressive glomerulonephritis. But if you notice, you see Team PKC and Team MDCU also have the word glomerulonephritis. It's something that's so interesting, but everything depends on the judges.
Could it be the same? Could it be right? Could it be wrong? That is all up to the judges' decisions.
And it seems like the judges are using a lot of time, but now they're done. So let's see who got it right and wrong.
And there we go. We have our answers marked with who is correct and incorrect.
Well,
Contestants, I would like to remind you once more that this is your last chance to appeal. I repeat, this is your last chance to appeal.
Um,
ก็ขออนุญาต appeal ครับเพราะ
In English,
oh,
please.
sorry. So I would like to appeal like because actually because like we have got just like a shortened name, but like we understand that maybe you need the clinical diagnosis, so we use like the shortened terms and use the full clinical diagnosis as a glomerulonephritis. Follow that.
As our rules state in the rule books that you have to answer in the full name only, except we have the abbreviation can be used in the question. So this question we did not have the sentence that show you that abbreviation can be used. So you have to answer in full name only.
Okay, thank you.
Thank you so much for your appeal. And I believe that our scoreboard is ready, so let's see the scoreboard, please. Wow, amazing. So we have Team SI1 at 10 points right now. How about the others, Janesta?
And for teams UPCM and PKC, y'all also got 10 points from the correct answer. Unfortunately, MDCU, you almost got the correct answer. So I'm rooting for you. And now let's continue with the correct answer of the next sub-question.
And the correct answer for the question 2 is type 2 antibody-mediated hypersensitivity.
Let's see what our contestants answered.
Wow,
Okay.
so I can see here that all the answers from the contestants are missing some word, at least one word. So that is really exciting to see.
Of course, but I believe that we have something much more exciting to see, right?
Yes, and that's who got it right and wrong. So let's see.
Congratulations, all teams, you answered it all correctly. Now, I believe, let's see the scoreboard.
And it's very fortunate that in this time, all the teams got 10 points. So now, SI1, UPCM, and PKC, you now have 20 points. MDCU, you now have 10 points. So let's continue with the correct answer of sub-question 3.
And the correct answer for the question 3 is crescentic glomerulonephritis.
Let's see what our contestants answered. Oh, okay. Well, at least 3 teams kind of answered it similarly. They all have one word.
Yes, but unfortunately, no team got the same answer as the answer key. So that must mean this question is really challenging for them.
Correct. This question might be really challenging.
And while waiting for the judges to grade the answers, shall we ask one of the 3 teams that got the same answer why they chose to answer this?
Of course, that sounds like a great idea, Janesta. I believe that MDCU answered diffuse. Would you like to try interviewing them?
Yes. So MDCU1, can you answer us why you chose to answer diffuse in this question?
Because the lesion affected more than and equal to 50% of the glomerulus.
Okay, let's see if the judges would take into account that answer. Okay, I believe that Team SI1 kind of answered differently from the rest, correct, Janesta?
Yes, so I would like to know your opinion to why you chose this answer and why it's so different from the other 3 teams.
To be honest, we don't really know, we guess.
Okay, so that's an interesting answer as well. I believe the judges will also take that into account as well.
And right now, the judges is ready.
Yes, so let's see who got it right and wrong.
And unfortunately so, all teams are incorrect. Again, if you would like to appeal, please appeal now. We will count from 5, 4.
Oh, we have PKC.
Sorry, we have an appeal.
Do they need more microphones?
So for the same reason that he stated before, I believe we understood that what you meant was that like the any lesion that involves more than 50% of the glomeruli tuft would be histopathologically termed as diffuse. Like yeah, that's what we understood from the question.
Back to the question, we asked about the histopathologic term when used when this lesion. You have to specify back to the histopathologic feature in your question. You can see the pathology in the glomerulus shows some lesion. We asked that if this lesion in the picture involved in more than at least 50% in the kidney biopsy, right? You have to say diffuse crescentic glomerulonephritis. We need the word crescentic.
So is there any more team that want to appeal?
Okay, if not, then let's move on. Let's see the scoreboard.
So in this question, all the rankings and the points remain the same as no team got the correct answer. So let's move on to the next answer of the sub-question.
And the correct answer for the question 4 is ruptures in the glomerular basement membrane or glomerular basement membrane disruption.
Now, let's go see what our contestants answered. There are a lot of varying answers this time, Janesta.
Yes. And I would say none of the answers are the same. Very interesting.
Correct. Actually, each team has a different answer, but let's move on to something exciting.
Yes, so we'll see who got it right and wrong.
Unfortunately, all teams are incorrect. So, would anyone like to appeal up on stage? If you would like to make an appeal, please raise your hand. I will count from 5, 4, 3, 2, 1. Okay, since there are no appeals, let's move on to the scoreboard.
So the scoreboard still remains the same in this question because unfortunately no team got the correct answer. So now we'll move on to the last answer of the last sub-question.
And the correct answer is non-collagenous domain of the alpha 3 chain of collagen 4.
Now, let's see what our contestants answered. Oh, so we actually have a team that answered very similarly, right?
Yes, exactly the same as the answer key. However, for the rest of the teams, you'll have to wait and see if you will get the point from our judges.
Correct, because these answers are so varied and so different, they might have a chance of getting the answer right too. Correct, Janesta?
Yes. And I can see that three of the teams' answers contain the word collagen type 4, so there might be some hints in the question.
Correct, but do you think that collagen type 4 is specific enough? Because the answer to that question was pretty long.
Yeah, I think it's way too vague. So we'll just have to wait and see. And now the judges have already finished checking, so let's see who got it right and wrong.
Congratulations, PKC! That was an interesting plot twist, correct, Janesta?
Yes, so this is the chance for them to surpass the other teams.
Of course, and this is your final reminder to appeal. After this, you will not be able to appeal. Okay, if there are no appeals, then let's move on to the scoreboard. Congratulations, Team PKC with 30 points. And second place, we have Team SI1 at 20 points.
Yes, and for UPCM, you also have 20 points, as many as SI1. And for MDCU, you have 10 points right now.
But we just only finished case 1. How many cases are there?
There are 3 cases, so 2 more. And who knows, the table might turn in the next round.
Correct, Janessa.
So now let's begin with the second case study.
Contestants, you have your usual 60 seconds to review the case study. Can't you believe it, Janesta? We're nearly halfway through.
Yes, and I've seen here that the game's like a roller coaster because one time one team is ranking the first and the other time they might fall down. Who knows?
Correct. Just because one team won the first case doesn't mean they'll stay forever in the lead.
Yes, so I want to remind all the contestants to not underestimate the other teams because I believe all of you guys are equally qualified here. So please try your hardest.
Of course. Are there any reminders that we need to give to the contestants, Janesta?
Well, you will be able to appeal even though you answered incorrectly in the first time, so please do not lose hope. And now the time is up.
Now let's move on to the list of labs. This list of labs is also long, Janesta, but do you think they'll be able to gain the fragments needed to get all of them?
To say they want to get all 10 fragments, they will need to get 10 points, which is pretty high. But I believe that all the teams are qualified enough to get some fragments to help our silver floor.
Maybe it's not necessary to gain all the labs. Maybe you just need to choose the right one. Contestants, you have 10 more seconds to review the labs.
And time is up. Now let's begin phase 1. Here is the keyword. The keyword of this sub-question is lymph node.
Let's show the question.
A 30-year-old man presents with fever, cervical lymphadenopathy, and splenomegaly. Lymph node biopsy reveals large follicles scattered in the mass of lymphoid tissue. The follicles show marked vascular proliferation and hyalinization of their abnormal germinal center. There is a tight concentric layering of lymphocytes at the periphery of the follicle. Which of the following is the most likely diagnosis?
Contestants, your 60 seconds starts now.
Time is up, so let's see the correct answer.
And the correct answer is Castleman's disease.
Now, let's take a look at all the contestants' answers and see whether they are right and wrong. Team PKC is correct. Team UPCM, incorrect. Team SI, Janessa, would you mind continuing?
For Team SI, incorrect. And Team MDCU1, also incorrect.
Did you just hear that, Janesta? How many teams got it right this time?
Only one team, Janesta.
Right, so Angel Sophia, thank you so much. Only one team. I can't believe it. How is that possible? Do we still have time before the scoreboard?
Yes.
Okay. If we still have time, let's actually interview Team PKC. PKC, are you up for an interview? Okay, it
Seems
seems
like
like they
they're-
might be busy. So
Yeah.
while we're waiting for them, let's discuss about this amazing turn of events. Angel Sophia, what is your opinion on this round of questions? Do you think that this one was particularly hard?
Yes, actually, I think this question is super hard. You just think about the Castleman disease. I think many people here never heard this disease before. Do you have ever seen or ever heard a disease like this before, ever, Queen?
I can't say that I have before because all I know is things of a fairy. I only know that a curse is something gained from natural disorders. However, humans have an ability to understand what those disorders are. So I believe only those who are actually human know what happens. However, now let's move on to the scoreboard.
So now PKC is ranking first with 1 point, and for the rest of y'all, you have 0 points.
It's okay, we have 3 more questions left.
Yes, so let's see the keyword. The keyword of this sub-question is liver.
Now let's show the question.
A 30-year-old woman presents with pruritus and jaundice. Liver function test shows an elevation of alkali phosphatase level. Magnetic resonance cholangiography shows focal dilation in some bile ducts and strictures in others. Liver biopsy reveals portal tracts with moderate dense lymphocytic infiltrate and a morphology of interlobular bile duct as shown. H&E stain, low magnification. Which of the following condition is most commonly associated with his hepatic disease?
Contestants, your 60 seconds starts now.
Ten seconds left. Now let's see the correct answer of this sub-question.
And the correct answer is ulcerative colitis.
Now let's see our contestants' answers and whether they got it right or wrong. Team PKC, correct. Team UPCM, correct as well.
Team SI1, correct. And Team MDCU1, also correct.
Congratulations, all 4 teams, you have redeemed yourselves and gotten this question correct.
Yes, you guys did a really good job. So, while waiting for the scoreboard, Queen, do you have any advice for the contestants?
Don't give up hope yet, or not. Don't worry, you can always let me win, you know. Anyways, let's move on to the scoreboard.
So now PKC is still ranking first with 2 points, and for MDCU, SI1, and UPCM, you all have 1 point equally. So now, let's see the keyword of the next sub-question. The keyword of this sub-question is male genital system.
Let's show the question.
Which of the following testicular tumors is classified as germ cell tumors unrelated to germ cell neoplasia in situ?
Contestants, your 60 seconds starts now.
Thirty seconds left. Time is up. Let's see the correct answer.
And the correct answer is spermatocytic tumor.
Now, let's see who got it right and wrong. PKC, correct. UPCM, correct as well.
SI1, incorrect. And MDCU1, incorrect.
That was a half and half there.
Yes, really surprising.
What a shocking turn of events from last time where we had all teams answering correctly, right?
Yes, it must mean this question is difficult for them.
Correct. Now let's move on to the scoreboard. And congratulations, Team PKC, with your 3 points.
And for UPCM, you now have 2 points. For MDCU and SI1, you all have 1 point. So, now we'll see the keyword of the last sub-question. The keyword of this sub-question is bone joint and soft tissue.
Let's show the question.
A bone biopsy from a 55-year-old man who presents with chronic bone pain shows the features seen in the picture. Which of the following viruses is the most likely cause of this disease?
Contestants, you have 60 seconds and your time starts now.
Thirty seconds left. Time is up, so let's see the correct answer.
And the correct answer for this question is paramyxovirus.
Now, let's move on to who got it correct. PKC, correct. UPCM, correct as well.
SI1, incorrect. And MDCU1, correct.
Another interesting turn of events. So that was 3 out of 4 teams that got it correct. Please give them a hand. Now, let's see the scoreboard.
Wow, so for Team PKC, you're still leading the scoreboard with 4 points. For UPCM, you have 3 points, MDCU 2 points, and SI1 1 point.
Okay, so with all of these, do we need to before we summarize or before we move on, let's discuss some of the points that we've seen. Isn't it amazing that PKC is already at the lead?
Yes, and I remember that in the last round, they also were leading the scoreboard. So it seems like they're in a good position now. So now let's translate each team's point into fragments.
So we have Team PKC leading with 7 fragments and Team UPCM with 6 fragments.
Team MDCU 4 fragments and SI1 3 fragments.
So after that we've collected our fragments, is there something that we need to do next, Janesta?
Yes, so these fragments will be used to purchase the lab results, which will be used to answer the next question. So PKC, you still have benefits over the other team since you have more fragments.
Right. And with these fragments, not only can you buy labs, you can also use them to answer the questions later on. So make sure that you choose wisely, as we have always reminded you over and over again. But we might still have some time to kill, don't we, Janesta?
Yes.
I believe we're in due of an interview, shall we?
Yes. So I would like to interview PKC again because they're the winner of the first case study, and for this time they're also leading. So I want to know how they're feeling right now. Are they confident that they're gonna win?
Of course. PKC, are you ready for an interview?
So they're busy
I feel like
again.
they're always ignoring the queen. Very interesting. But how about the other teams? Maybe we have a chance with them.
So should we interview UPCM since they're in the second ranking? So UPCM, can we interview you all? Yes, you. So can we know how you're feeling right now as you're in the second ranking of the scoreboard? Are you feeling confident?
Sorry po, but I think our previous answer was counted correct, but we actually wrote a wrong answer. Yeah.
Okay, no worries, but thank you for letting us know. Our staff members will be with you shortly. I believe we have an updated list on our fragments. Right, Janesta? Would you like to read them aloud for our audience?
Yes, so there's a bit of change. PKC still has 7 fragments and still leading the scoreboard. However, for MDCU and UPCM, you're in the same ranking with 4 fragments. And SI1, you still have 3 fragments.
So there has been a little bit of a change, but nothing has changed in terms of the importance of labs. Correct, Janesta?
Yes, but even though you don't have a lot of fragments in your hand, you might be able to use your knowledge to choose the right one. So still, just keep your hope up. And now, we will now begin phase 2. Let's review the case study again. You have 45 seconds. And time is up. Contestants, you have 10 minutes to choose your labs.
just as a quick reminder, contestants, we will immediately start the next phase if all teams choose their labs and all teams enter their labs into the system.
Another reminder is that for all the contestants, you have to use up all of the fragments in order to gain the lab result.
Minus 7 minutes. Minus 6 minutes. minus 3 minutes. T minus 1 minute. T minus 60 seconds. T minus 40 seconds. T minus 30 seconds. T minus 20 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Time is up, contestants. And after this, we shall begin phase 3, correct?
Yes, so contestants, you will have 7.5 minutes.
Okay, usually in the phase 3, we will have 7.5 minutes to answer 5 questions.
Okay, but right now, we've seen here that some lab results are not yet delivered to the system, so we're gonna wait for a bit.
Okay, so while we're waiting for that, how about we look at our audience members to see whether they're excited about this round? Yes, Janessa, would you like to go and interview that side of the stage?
I would like to continue the interview, but right now all the labs are locked in, so let's begin with phase 3, shall we?
Of course, then. Of course. Contestants, you have 7.5 minutes to complete 5 questions. Your time starts now.
30 seconds left. And time is up. I believe that the contestants have already locked in their answers to the 5 questions. So now we'll move on to the correct answer of each question, starting with question 1.
And the correct answer for the first question is changeable body macrophage.
Let's see what our contestants answered.
Wow, so from what we've seen here, there are 2 teams that got the exact same answer as the answer key.
While the other 2 teams, such as SI1 and MDCU, both answered different answers. What an interesting like array of answers, right, Janesta?
Yes, and now it's a half-half situation. So we'll have to wait and see if the 2 teams will get the point from our judges.
That is also correct, Janesta. Who knows? Maybe a centroblast is the same as a tingible body macrophage. It all depends on what our judges agree on. Do we still have some time left, Janesta?
Yes, we still have some time left since our judges are not finished checking the answers.
So would you like to interview teams SI1 to see why they answered it correctly?
Oh, yes, but I think we'll move the interview to the next question because right now the judges have already checked the answers and now let's see who got it right and wrong. Well, as expected, PKC and UPCM, you all got the correct answer and gained 10 points. However, for SI1 and MDCU, unfortunately, didn't get any points in this question.
Contestants, you have one last chance to appeal before we move on to the scoreboard. So contestants, if you would like to make your appeal, please do so now. And I believe that there are no appeals, so let's move on to the scoreboard. Okay, so congratulations again, PKC, with a score of 40 points.
And UPCM, you're ranking second with 30 points, only 10 points far from PKC, which is not a lot.
Actually, there's also a lot of room to catch up, but I believe that we should move on to the next question, shall we?
Yes, so let's see the correct answer of question 2.
And the correct answer is germinal center B cells.
Now, let's see what our contestants answered. Oh my. Oh, look at this. It is very different from the answer, right? There are different answers in this round.
Yes, but there are 2 teams that have the same answers, which are PKC and SI1. And for UPCM and MDCU, they all got completely different answers.
Of course. So, does that mean that their interpretation might be a bit different from other teams?
Yes. So now we'll see who got it right and wrong.
Congratulations again, Team PKC and SI1. Now this is your last chance to appeal for this question. Are there any appeals? If there are none, I believe we shall move on.
Yes.
So let's see the scoreboard.
So PKC, you're still ranking first on the scoreboard and you're 20 points ahead from SI1. And for UPCM and SI1, they all get the same point, 30 points.
There's still of a little bit of a gap, so maybe they can catch up to PKC.
Yes, so now we'll move on to the correct answer of question 3.
And the correct answer for the question 3 is centroblast.
Now let's see what our contestants answered. Oh, so there are an interesting array of answers again, Janesta.
Yes, so for team 2 and for team UPCM and MDCU, you all got completely different answers from the answer key. How about the other 2 teams?
Right, it seems that there's like a variety of answers such as centroblast, centrocyte, blast count, centrocyte, and also T cells. I actually thought that since the other teams answered like centroblast so often, they might have gotten this question correct.
Yes, I really hope so too. So now let's see who got it right and wrong.
Oh, and that is so unfortunate. All teams got this question wrong. If anyone would like to appeal, please do so now, because after this, we won't be able to appeal once the scoreboard appears.
Oh, there's PKC.
Okay, there is an appeal.
From the PKC team. The answer that we have answer is central brass and the central size. I think I don't sure what about the staging of this, but I remember that to give a state in follicular cell lymphoma is to use the ratio between central brass and central size. We cannot use the central brass alone.
We count number of centroblast and mainly, okay, for a low grade, okay, we count 0 to 5, 5 to 10 number of centroblast. Yeah, not a ratio.
Okay, thank you. Thank you.
Thank you, contestants, for your appeal. Oh, I'm so sorry. There is also another appeal.
Hello, we would like to appeal blast since the blast we're referring here is the centroblast and our previous answer was centroblast, so this is what we were referring to. Thank you.
Again, please, sorry. One more time, please.
Sorry, our answer is blast and our previous answer was centroblast. This is what we were referring to, and since the phrasing was what we're counting, that's why we included blast count. But technically, this is the centroblast that we answered previously.
The meaning is different. If you say blast count, so it means you think for blast. Hello. And if you only say blast, it can be myeloblast or lymphoblast. Okay, there are lots of blasts. Okay.
Is there any other team that would like to appeal?
If not, I believe we can move on to the scoreboard, correct?
Yes. So let's see the scoreboard. So the rankings and the scores remain the same.
Right. Nothing has changed yet, but that might change within the answer to the next question, correct, Janesta?
Yes. So now let's see the correct answer of the next question.
And the correct answer for the fourth question is BCL2.
Let's see what our contestants answered.
Wow.
Okay, so that's 3 out of 4 teams that actually answered correctly according to the answer key. However, we have one team that answered differently,
which is SI1. And I would like to know their opinion, why they chose to answer this, because it's so different from the other teams. Can one of y'all answer this?
is our team mistake.
It's okay. Mistakes happen all the time, and maybe you can redeem yourself within the next question.
Yes, so now let's see who got it right and wrong. So as expected, PKC, UPCM, MDCU, you all got 10 points from the correct answer. And it's okay for SI1, you'd still have 0 points for this, but there's still one more question left.
Who knows, you might change the tide soon enough. Now, let's look at the scoreboard.
Well, so PKC is still ranking first, and it's looking really great to them since there's only one question left.
Right. But shall we look at the answer to the next question, Janesta?
Yes, so we'll see the correct answer of the last question.
And the correct answer for the last question of the case 2 is paratabacular area or pattern.
Now, let's see what our contestants answered.
Oh, from what we see here, no team answered the same as the answer key. I don't know what that happened.
That is true. And not only that, they didn't even answer the same amongst all the 4 teams.
Yeah, it's very interesting. That must mean this question is extra difficult.
Of course. This question might be very difficult to taunt even the best of heroes.
Yes, but so now we'll see who got it right and wrong.
And as expected, none of the teams got it right. However, this is your last chance to appeal, so if you would like to appeal, please do so now. If there are no teams that are going to appeal, then let's move on to the scoreboard.
So in this question, no team got any points. So the scores remain the same. PKC ranking first, UPCM ranking second, SI1 ranking third, and MDCU ranking fourth.
And that concludes our second case, Janesta. We are completely 2/3 of the way in.
Yes, so now we will continue with case study 3, our last one.
So we will have the contestants review the case study for 60 seconds. Janesta, how are you feeling about this competition?
I'm really nervous because I can see here that the scores and the ranking, they can change at any time. Anything could happen.
Of course. And the gap between each team is very thin. So there is a chance that one might be able to overrule the other.
Yes, and from what I've seen from the previous games, PKC did rank first in both of them. So it might be a good news for them, right?
Right, it might be good news for them. However, there is still one more case to go. Who knows? Other teams might change the answers, might change like the favor, might turn the tides. Right, so now the time to review the case study is over. Now let's move on to the list of labs. And as I always say, Janesta, what is the importance of labs?
Well, the labs can be used to answer the questions. And in order to gain those labs, you have to gain some points which will be used as tokens to buy the labs. So the contestants have to try their hardest to gain the most fragments they can.
Right, but owning fragments is not enough. You must actually be able to use those fragments to your benefit. As always, a doctor cannot use only all the equipment they have. They must use the things that they have at their own disposal. Is that correct, Janesta?
Yes. 5, seconds left. Time is up. Now let's begin phase 1. Here is the keyword. The keyword of this sub-question is lung.
Let's show the question.
Which of the following is the most histopathological characteristic of cryptogenic organizing pneumonia?
Contestants, your 60 seconds starts now.
Thirty seconds left. Time is up. So now let's see the correct answer.
And the correct answer is intraalveolar fibroblastic plaque.
Now, let's see whether our contestants got it right or wrong. Team PKC, correct. UPCM, correct as well.
SI1, correct. And MDCU1, also correct.
And that is correct for all teams. Congratulations. You all earned the first point to the sub-question. And now, are we waiting for the next sub-question, Janesta, or do we still have some time?
We still have some more time.
Great, then why don't we, oh, so sorry. Now let's move on to the scoreboard.
So right now, all the teams are ranked the same with 1 point equally. Congratulations.
Congratulations again.
So now let's move on to the next keyword. The keyword of this sub-question is pancreas.
Now let's show the question.
Which of the following morphologic changes favors pancreatic adenocarcinoma more than chronic pancreatitis?
Contestants, your 60 seconds begins now.
Time is up. Let's see the correct answer.
And the correct answer for the second question is laws of lobular architecture.
Now, let's see whether our contestants got it right or wrong. Team PKC, correct. Team UPCM, also correct.
Team SI1, correct. And Team MDCU1, incorrect.
Okay, so this is a different trend now, right? 3 out of 4 teams.
Yes, so it's really exciting to see who's gonna win.
Of course. Are we ready to begin?
Not
to see
yet.
The
I
scoreboard
think
or no?
we still have some more time.
And right now, I see the scoreboard is ready.
Okay, so
let's see the scoreboard. Congratulations! So I see that team SI1 is at 2 points. Is at first place, correct?
Yes, so the same as UPCM and PKC. For MDCU, you have 1 point. So now, let's see the correct answer. Let's see the keyword of the next question. The keyword of this sub-question is endocrine.
Now, let's show the question.
This is a pathology of an intracranial tumor from a 15-year-old boy is shown in the picture. H&E stain, low magnification. Which of the following is the most common location of this tumor?
Contestants, your 60 seconds starts now.
Thirty seconds left. Time is up. Let's see the correct answer.
And the correct answer for the question 3 is supracellular area.
Now, let's see whether our contestants got it right or wrong. PKC, correct. UPCM, also correct.
SI1, correct. And MDCU1, also correct.
Congratulations, all 4 teams. You got it correct.
You guys did a really good job in this question.
Right, and is our scoreboard ready?
I think we still have a bit of time left to talk.
Great, then. Well, maybe not so. The scoreboard is now ready.
Let's see the scoreboard.
Right now, we're at a little bit of a stalemate, aren't we, Janesta?
Yes, so team SI1, UPCM, and PKC, you're all tied with 3 points, and MDCU, you have 2 points.
I wonder who will break this 3-way tie, Janessa.
Yes, I wonder the same too. So now let's move on to the next keyword. The keyword of this sub-question is neuropathology.
Now, let's show the question.
A 30-year-old man presents with fever and mental status changes. Computer tomographic scan of the brain reveals bilateral hemorrhagic lesions in the temporal lobes, especially the anterior medial part. The patient soon dies, and the histopathology of the brain autopsy shows necrotizing inflammation, perivascular coughing, and cytopathic inclusions in neurons. Which of the following is the most likely causative agent?
Contestants, you have 60 seconds, and your time starts now.
is up. Now let's see the correct answer.
And the correct answer for the final MCQ is herpes simplex virus.
And let's see what our contestants answered. Team PKC, correct. Team UPCM, also correct.
Team SI1, correct. And Team MDCU1, also correct.
Congratulations, all 4 teams. That is an impressive trend. So now the gap that's already close is now even more narrow than before, correct, Janesta?
Yes, and it's really surprising to see this event that everyone got the correct answer 2 times in a row.
Of course, everyone is giving a fighting chance. Now, let's move on to the scoreboard. Just as I said before, correct, Janesta?
Yes, so SI1, UPCM, and PKC, you're still tied with 4 points. And MDCU, you have 3 points. Now, let's translate each team points into fragments.
Look at that impressive three-way tie, Janesta. It seems like SI1, UPCM, and PKC both have 7 fragments in